gott folk. Det börjar vara kello on klocka. It is 9 o'clock. Tack! Ei tarvinnut edes mitään viheltää, vaan huomenta, good morning, good morning. Lämpimästi tervetuloa tänne meidän yhteiseen aamusessioon. And the theme is the path towards transdisciplinary university wellbeing services county. Katsotaan, osaanko mä käyttää tätä. Ei kun osaan. Sådär. Här är kort programmet. Jag ska göra en kort introduktion till temat och sen har vi Suvi, joka avaa sitten, mitä se ihan aikuisesti oikeasti enemmän käytännössä tulee tarkoittamaan. Och sen har vi eminenta talare här, warmly welcome Iñaki coming from quite a long way. Ja sitten meillä on meidän Suomen tutkijoita paikalla. Me pidetään myös tauko sitten, että älkää pelätkö, että me måste sitta nästan till klockan 12 på plats. Men hörni, te näette tuolla tuollaisen pilven, Pohjanmaan yliopistollinen hyvinvointialue, ett universitets välfärdsområde. Vad är det för slag för konstigheter? Och det är det vi ska prata om nu. Tänä hetkenä se on tämmöinen vähän niin kuin tuolla pilvenä visiona meillä. Me ollaan valtuustoseminaarissa tätä. On noussut esille hallituksessakin siellä pilvimuodossa. Ja tänään me tullaan nyt käymään vähän syvemmin siihen läpi, että mitä tämä visio voisi meidän alueella ja Suomelle käytännössä tarkoittaa. Vi ser hur jag lyckas slida här på engelska så att vad heter det, man ska kunna följa med. Ja mä puhun sitten tuttuun tapaan sekakielellä. Että sitten saatte sanoa, että ei Anne nyt mene ihan hassusti. Sådär. Mutta hei, miksi me tarvitaan tällaista? Alltså varför behöver vi någonting sån här nytänk? Jokainen täällä on alan rautaisia ammattilaisia, niin me tiedetään ikääntyvä väestö, eller hur? Vi ser hur kostnaderna höjs. Som beslutsfattare har man något hicka när budgeterna ska behandlas, och man ser också hur det ser ut för Finland överlag. Sen så ser vi också det att hur det kan variera lite hur det är med vilken effekt till exempel inom forskningen som här, att går det faktiskt, että meneekö se oikeasti sinne käytäntöön. Eli meillä on valtavasti täälläkin tutkijoita, hienoa tutkimusta täällä tehdään, aivan loistavaa, mutta miten se näkyy sitten sen pienen vi har massor med kulturer som vi ska vara glada och stolta över här. Vi har enormt stark industri här. De av er som har varit här på de här dagarna så vet med vår exportindustri. Alltså det går ju relativt bra för Österbotten, eller hur? Eli meillä on aika hyvä alusta täällä lähtee kehittämään tätä. Mietitään myös, en tiedä, onko joku kuullut energiaklusteri? Kukaan ei niin. Ja, men tanken är ju, vet ni, att vi har det här ekosystemtänket redan i vår region, eller hur? Det där tänket redan finns. Nyt on aika tuoda se myös, että me tuodaan se tänne meidän sote-kentälle ja otetaan sitä isosti käyttöön, koska sillä tavalla me ihan varmasti päästään myös tuloksiin. Tämä on semmoinen sopivan kokoinen alue lähteä kehittämään näitä ja sitten saada niitä jopa skaalattua laajempaankin käyttöön. Ja me tarvitsemme tähän tietenkin sitten meidän yliopistot, korkeakoulut. Ja tässä nyt on, mitä meillä on Pohjanmaalla, pelkästään Vaasassa. Te näette, meillä on aika hyvä luettelo sitä, mitä meillä on koulutusmaailmaa, tutkimusta täällä jo tehdään. Så det handlar nu om att liksom samlas runt samma bord och tillsammans börja utveckla, innovera och sedan föra det in till praktiken. Och vi har här kring 20 000 studerande redan. Och här, nu står det inte här, men så är det också det att sen ska vi också lite höja blicken. Det är inte bara här i Österbotten. Jag är jätteglad att här är lite nordiska vänner med också. Vi har en mental bro över till Umeå för tillfället. Det kommer säkert en dag, kun meillä on sinne ihan oikeastikin silta ja lähdetään sitten isommin visioimaan, että vad kan vi göra här över också Kvarkenregionen tillsammans. Här ser ni själva visionen som vi tänker just nu. Att vi ska ha ett sån här yliopistollinen hyvinvointialue, että me oltaisiin täällä se johtava taho, tämmöinen niin kuin platformi, jonne kerätään hyvinvointialan tutkimusta. Ja koko ajan puhutaan nimenomaan siitä hyvinvoinnista. Tämä ei nyt ole sitä, että on vain sitä sairaanhoitoa ja terveyspuolta, vaan vahvasti se sosiaalipuoli sinne. Johtaminen YMS. Täällä pääsette myös näkemään, että no miksi sitten nyt? Då vi tittar på hur vad heter det ser ut i Finland, vi vet alla att vi måste ha nytänk. Det går inte att fortsätta som det har varit hittills. Det är liksom, vi måste tänka om och det här är ett sätt för oss att faktiskt svänga om, hitta de där lösningarna som går dit till det där preventiva, som hittar de här tidiga ingripande modellerna för att vi sedan också ska kunna göra de här inbesparingarna på den där dyra sidan. Det må vara då specialsjukvården eller inom sociala sidan till exempel. Alla vet vi vad ett omhändertagande av ett barn kostar. Så vi måste på riktigt hitta och svänga på den här sidan. Vi tänker att här i Österbotten så kan vi liksom samlas runt vad heter det, samma bord, och vi har som sagt alla möjligheter här. Som sagt, liksom grunden finns här redan. Och det var väl så att jag tror att det var förra året på miten Pohjanmaa Voi-päivällä så var det min vän Joakim Strand som också pratade om det här. Att ett sån här liksom ekotänksystem så ta in det hit i sote-sidan också. Viimeisenä. No nyt tämä on tämmöinen niin kuin visio ja ajatus, tätä me niin kuin tarvitaan, ja jotenkin ajattelen, että Pohjanmaalla pöhisee, eikö niin? Ja Pohjanmaa myös vie maaliin asioita. Sitä täällä on totuttu tekemään. Men det är klart att det kommer också att behövas politiskt stöd. Det kommer att betyda, och vi har alltså, om man tänker på regionnivå här nu, inom välfärdsområdet så har det varit pienesti siellä, että sitä esitellä, hei tällaista visiota, joo, lähdetäänkö sitä kohti, mutta tässä oikeasti päästä siihen niin kuin puoluerajojen ylittävään yhteistyöhön. Minä edustan vain yhtä puoluetta, kansallisesti aika pientä puoluetta. Mä tarvin, niin kuin täällä mä näen teitä kollegoita, että tätä tehdään sitten yhdessä, että me oikeasti Pohjanmaan takia, mutta myös koko Suomen takia. Eli tarvitaan sitä, että rakennetaan niitä yhteisiä siltoja. Sitten tulee sen aika, kun me tehdään niitä poliittisia päätöksiä. Tämä ei ole ollut missään poliittisessa varsinaisessa päätöksenteossa vielä. Tänään visioidaan. Katsotaan, mitä täältäkin tulee uutta. Meillä on hurja hienoja luennoitsijoita, että mitä me saadaan sitten sisään siihen malliin. Men det kommer också att behöva alltså starkt påverkansarbete nationellt från oss. Att vi på riktigt alla använder de kontakter, också de här politiska kontakterna som vi har, att hej, att de håller på med någonting ganska spännande där i Österbotten, att det skulle lönas till, är det då julklappspengar eller I don't know, näitä rahoja kuitenkin löytyy, että saada niitä jotenkin tähän mukaan. Että olen täysin vakuuttunut siitä, että se tulee hyödyksi siis niille ihmisille. Sitä vartenhan tätä tehdään, eller hur? Det är de där människorna som behöver den där vården, omsorgen och räddningstjänsterna. Att de sedan ska gagnas av det här. Joo. Ja sitten jos joku miettii, no onko tämä nyt sitten se yliopistosairaala siellä taustalla. Det är en vision som jag tycker också att vi ska hålla fast vid. Det här kan vara ett steg mot det. Det vet vi att just idag att börja starta upp någonting sånt, men det här jag tror Suvi sa fiksusti, vi hade undervisningsministern här i onsdags, så tämä ei poissulje sitä, mutta tämä, jos sitä joskus ei tulisi, mutta kyllä se tulee, niin tämä tuo sitten jotain muuta ja uutta tullessaan. Men nu är det så att Suvi kommer att berätta sen så det liksom mer att mitä se niin kuin käytännön tasolla on ja on siellä on kuulkaa aikatauluja vaikka mitä, niin onko sulla omaa tämmöinen? Otatko sä mun oma? Sä voit ottaa mun oma.
Oi. Tää ei kyllä ole yhtään. Joo. Okay, so do we have questions for Anne before I start? No, not yet. Hopefully during the day you are starting to have questions as well. But for me, this is a huge day. It's a day where dreams are starting to come true, and it's a day where it shows that you need to dream big and do it even bigger. And this is a start. So I decided when I left from home that this is a day when I'm going to use high heels. I usually don't, as you know, I'm always with sneakers. And I left from the home with my kid, 7-year-old Isla, who started primary school on Wednesday. And on schoolyard, I looked at the back seat of my car and saw that, yeah, they are those my high heels, but they are different pair. So I decided to come with sneakers, and still without high heels, it's a huge day. And I'm so happy to see you all here, to see how many of you have taken the time to come to here and discuss about the idea. This gives me hope that this is really coming true. Okay, so University Wellbeing Services County, what it is. First, I want to say that this is not about achieving new status. It's about embracing a new role. It's about building a role we don't have in Finland yet. But we in Ostrobothnia, as Anne said, we have the potential to do it and do it big and do it differently than it's done in every other parts of the Finland. So together with our partners, together with you all, and hopefully many, many more, we are building a transdisciplinary Sote InnoHub ecosystem. And we started to use the word transdisciplinary because, as we know, quite often we are in those silos, in different research silos, in different occupational silos, and that is something we don't want to have anymore. But we want to have, if you put it in Finnish, tieteenalat ylittävä. So we really do things together. We are building a platform where research, development, education, and innovation brings together all these disciplines to advance healthcare, social welfare, and rescue services. As we know, in traditional model in Finland, we have in those bigger cities where we have faculty of medicine, then we have university hospital. Well, as Anne said, it can be that someday we have that also, but today we are not, and that is not the biggest goal of this, what we are doing now. In those areas where university hospitals are, we know that they have huge amount of research around the medicine. But Wellbeing Services County is not about the medicine. It is also about the medicine. I saw, sorry, we have medical doctors here. Of course, it is also about the medicine, and it is one of our keystones. But it is so much, much more than just the medicine. And this is what we are trying to do. This is what we are trying to build. So we have together health sciences, social sciences, we have medicine there as well. We have administrative sciences, we have management, security, preparedness and resilience. We have psychology, we have technology. We know all how huge jumps have we done around technology development. We have economics, we have environmental, regional development. All these together are our new Sote Hub. So our goal is to establish a center of excellence for human well-being services, innovation and research. We don't just want to organize and provide social health and rescue services. We want to be a center of excellence. So, how does it look in practice? We are building a living lab ecosystem where research is embedded in everyday life, in real-world patient and client journeys. We are offering rapid testing, piloting and implementation for companies, for startups as well. What we want to have is impact on people's everyday life. That is the key goal. And we want to do collaboration across all these disciplines. So in our Sote Inno Hub, research and decision making goes hand in hand. As we know, we do have quite much research at this point already, but simultaneously we know that quite often when we make decisions, we don't use the information, all the research we have when we are doing the decisions. So this is something we want to emphasize on. And we will become a national leader in evidence-based impact. We are building a distributed campus model with our strategic partners, and we do have multiple universities and higher education institutions in Finland and in Nordic countries in this collaboration, in this Sote Inno Hub. And we do integrate all the students and researchers in our everyday service delivery, and also higher education institutions. Here at the top of the slide, you see our megatrends. We have been discussing these in our decision making processes in our top management team and in our council, and in our board. And so there are 5 big megatrends that are shaping our world. And in our Sote Inno Hub Living Labs, we want those to be our strategic priority themes. So, safe living at home in longevity society, time for people, from reactive care to lasting impact, accessible and equal services, and ensuring trust and service continuity under all conditions. So all the professorships we are building are connected to these priority themes at one way or another. And not just like, okay, social workers are on this side, and doctors are on this side, and rescue services are on this side, but going across all the disciplines. At the core of this, why are we doing this? What is the value here? It's value for people, and that is in the center of everything we are doing. It's for economic sustainability, and it's system level impact. So these 3 levels, we are trying to create value. And then we have built also some value propositions for our future partners, and also partners that we are collaborating already, as we have here 2 professors today that we have had really successful and really impactful collaboration already. So for universities, for higher education institutions, we promise an exceptionally broad collaboration environment. We promise direct access to real-world health and social care services. We promise opportunities for high-quality research. Today, Mika Kortelainen is telling for our first try, and it was quite successful, and it was quite impactful, and it was high quality, what we did. And also opportunities to develop innovative models for education and research. For companies joining us, we are promising real-world innovation and testing environment. We are promising rapid piloting and validation, and we are promising co-creation and collaborative development. And for our funders, we are promising high societal impact, scalability and transferability, and strong international potential. And today we have Iñaki here from our newest collaboration partner from Eureka Network, and I believe that we can do something big together as well. We have first funding applications on process now. So, put it simple, 3 points, as our president Stubb used to do. So, value for customers, from research to practice, and from practice to research, and value for society. And those 3 are main things we are building here. Should I take this now or at the end of our session? Maybe I could, yeah. Okay, so we take this at the end of our session, and I believe that now you remember that this is, no, they don't now remember. They have something else to do, but we will find it. So, thanks for my part. I am so happy and honored to be here. And now, if you have any questions, I believe that we have a few minutes time. Now you can applaud if you don't have any questions. Okay, we do have one question. Do we have a mic?
No.
But it still won't go there, yeah.
Doesn't help for the stream.
Yes, thank you very much. I was thinking about this, like for the greatest impact of this, we probably need to attract the greatest talents.
Yeah.
Have you thought about how we should do that in the region?
Yes, we have thought about it, and we believe that one thing is that first, the most important thing is that already now, when we have started to discuss about this, our researchers and people, I believe that even today we have quite many people who wants to be a researcher, who wants to do the research. And one thing is that to be able to be part of something new, to be able to think bigger, to innovate, to do something new, that is quite a huge motivation. But then, of course, you need time to do the research. And that is one thing we are trying to build, that a model where our researchers and developers can actually use time for that. So for time, you need money. And to be able to give money, you need funding. And this is the thing we are trying to build, that to be able to put our budget in a way that there is enough funding, enough resources for the research. So I believe those two are the key elements. And now there is quite good time. Where is Elina? Okay, can you stand up? So I want to present our new R&D director, Elina Laukka, who has started this week's Monday. And we are so happy and proud to have Elina with us, because now we have more power to do this all, what we are speaking at the moment. So please contact Elina. And of course you can contact me as well. Okay, so then it's time to present our next speaker. We met on Bilbao, I think it was in the end of May, yeah, through that. And I was really impressed the way Basque country has done research, innovation and development. And we are now in the same Eureka network. And after a few days in Bilbao, I said to Iñaki that you should come to Vaasa. And Iñaki said that, yeah, if you just invite me. And here we are. I invited and he came. And so pleased to have you here. Please welcome Iñaki Gutiérrez.
Huomenta, kiitos. So yeah, it was. I'm also by solidarity. I'm not wearing high heels, so that's why I'm wearing sneakers. So what to say? So first of all, thank you for inviting me to be here. I'm sorry that I cannot speak Finnish or Swedish, so you will need to understand my poor English. So I will try to do my best to go how we have gone through the journey in the Basque country. First of all, it is where the Basque country is. I don't know if you were knowledgeable about that. We are not keen on paellas, not bullfighting. So we are far north in Spain, quite close to France. In principle, also a part of France is ours, because you know that we have also three provinces in France. So the Basque land, we call the Basque land, it is in between Spain and France. And we are quite Atlantic. So independently that when they came to us with the Eureka meeting, it was too hot in May. For us, it was too hot. So normally it's raining. So we are quite Atlantic. Another thing, why we were known in the world and in the Scandinavia. So first of all, we were one of the best harpoonists in the world. So we were the best in killing whales at one time. And also in Scandinavia, we were quite famous because there was a law in Iceland by which legally permitted citizens to kill Basques. And it was from 1615 to 2015. So it was abolished just 11 years ago. So that's why the first time I went to Iceland, it was 2016. But apart from that, nowadays we have converted the killing whales into a sport. Those were the boats that were used to kill whales, and they were killing whales and carrying the whales back to the ports. In most of the ports in the Basque country, we have a whale in the flag. But nowadays it has converted into a rowing sport. By the way, my hometown, was one of the best right now. And another thing that is important, it is that we also, the Basques are safe in Iceland once again because the law has been erogated. Apart from that, why are we known in the world and in Scandinavia? First of all, because of the transformation of the city of Bilbao. It was in 1984, it was a very industrial city, quite dusty and polluted with many things. And now it is converted into a service and business-oriented city. And the good thing is that we are not in debt. So the industries were in need to carry on with the transformation. And it was also known in the world because of the Guggenheim effect. So probably it is one of, and it is funny because the president of the region at that time was against the museum. So it was a wrong idea. I don't know if there is there was the first quota that it was, if there is a will, there is a way. I don't know if that was the way, but it functioned. So another thing is why are we known in the world and in Scandinavia? Also because of stone lifting. We are one of the strongest men in the world. Nowadays, women also. So it is the record is 329 kilos right now. So it is stone lifting, and also because of gastronomy. That is famous in Spain. They call tapas. We call pinchos. So that is a little bit different. That we use sticks. That's why it's called pinchos. And apart from that, we have the Basque Culinary Center. We are one of the biggest and highest, I would say, recognized place in the world because we have right now, 36 Michelin stars in a very small area with 26 restaurants. Among those, 4 are three stars Michelin, 2 stars Michelin, and 21 star Michelin. So probably in terms of how it is embedded in a so tiny place, it is huge. So some key facts. We are 2.2 million inhabitants in a very small area. So we are quite concentrated. From one side to the other side of the Basque Country, it is 1 hour and 40 minutes by car. So it is quite well connected by motorway. We have, as you hear, we have 2 official languages. So perhaps it is something that we need to also to share with Ostrobothnia. So we have Spanish and Basque, and most of the people can speak in both right now. Although it was like in Finland, it was forbidden for almost 45 years. Even my grandmas were even committed to go to prison because of speaking Basque language. So it is high level of self-government. Probably we are the most independent region in the whole Europe. That is the reality, because we have the Basque Parliament, we have a government with great legislative and executive powers, and we are one of the 2 regions in Spain that we have tax collection by our own. So that means that we know how much money we have, and then we negotiate with the Spanish government in terms of how much we do need to pay. It is true that we are one of the wealthiest regions in Spain, and because of that, we need to pay more than others. So we deal nowadays with education, health, security, and police and prisons, and nowadays with social security. It is something that also we are going to deal with our taxes. We have, as I said before, fiscal and financial autonomy. So that means that we have fiscal legislation, tax collection, and administration powers. For example, that is something that is different to that in Catalonia. They don't have tax agency, so they need to wait for money coming from Spain right now. And we have one of the highest human development indexes in the world. We are located 14 now in the world. Wealthiest region in Spain, although the people from Madrid, they think that they are the first. And in terms of, we are in the middle of European average in terms of how much we spend in terms of research and development. And as Ostrobothnia, we are a sport-oriented economy from the very beginning. In terms of the main features of the Basque Country research, development, and innovation, we have a country centered on innovation, and it was because of the crisis of the. You have seen what happened in the 80s, that Bilbao was polluted, it was industrial, and no stainless steel company, no shipyards they are anymore. So we need to reinvent, in some way, reinvent the wheel. And we have a cohesive system, so that includes the quadruple helix that it has been mentioned before: academia, public administration, industry, and the community. And we decided, and it is something that also we share with Ostrobothnia, we decided to go for 3 areas of smart specialization. One was energy, because we have the 4th world company in terms of electric power. It is Iberdrola. You saw the tower in the center of Bilbao. We call the Mordor Tower. But it is we are centered in energy. We centered in advanced manufacturing. That is one of the key features of the industrial heritage in the Basque Country. And most of the machines that are building any kind of other tools in the world, probably they are designed in the Basque Country. That is the reality. And also, I don't know why, we decided to go for biohealth. And it was a big transformation, and you will see why. In terms of research and development, we are one of the top innovative regions, the highest in the case of Spain, even more than Catalonia and Madrid. And in terms of the Basque health system, we have a universal health system, financed by taxes, so it is no social. So we are in a beverage system, not in a Bismarck system. It is governed by the principles of universality, equity, solidarity, equality, and participation. And every single citizen that lives in Basque Country, including immigrants, they have access to health, and that is for free. So free access to the system for residents in the Basque Country, and each citizen is attached to a doctor. And another thing it is that the family physicians are part of the system. So they belong to the same system. So we have the Basque Health Service that provides 93% of the services, and primary physicians and community nurses are part of the system. So they are not self-employed. That is something that is also differential to other parts of the world. Nowadays, the second biggest company in the Basque Country is the Basque Health Service. Almost 45,000 employees are working for the system. Life expectancy is one of the highest in the world, so it is 87 for women, lucky you, and 81.7 for men, and the mean it is around 84. And we have one primary care physician per 1,500 inhabitants. That is another thing. And we believe that primary care is the key of the system in terms of sustainability. And mainly community nurses are also keen informing about that. And we have an integrated healthcare system. So probably there are only 3 places in the world that they can say that they have an integrated healthcare system, because we go from primary care to tertiary hospitals, and everything is interconnected. Another thing is how we do that. So we divide the region into sub-regions. So we have nowadays 13 sub-regions. In each of those there is a hospital. Not in all of them there is a tertiary hospital. I will explain a little bit more about that. So we have the Ministry for Health that is dealing with planning, financing, and regulation. We have specific agreements with different providers of services, but mainly it's the Basque Health Service that is public, that is dealing with the services. And we have also agreed centers, so there are private centers with which we have also some kind of contracts in some parts. This is the whole network. We have 140 primary care centers in all the distribution. We have 5 university hospitals. 2 of those are tertiary hospitals and 3 general hospitals. 7 acute hospitals that are territorial, and 3 medium and long stay hospitals, especially for palliative care and also recovery and rehabilitation. And 3 mental health networks, 1 in each of the provinces. Probably you know that we are divided in 3 provinces. That is the Spanish Basque region, so San Sebastian, Bilbao, and Vitoria. Technicalities, we have integrated healthcare record in the whole system. So any single physician, nurse, or worker of the health system, they can access to any single citizen, and they use the same information system. So that is in the whole system. So it is secondary and tertiary care, including nursing homes, including the nurses or the physicians that are working in nursing homes. They have access to the same electronic health record. and every single piece of information that is written immediately goes to the system, and the next day, everyone has the same information. We have all professionals have access to the electronic health record. We have e-prescription, so you go to the pharmacy shop and everything is registered, and we know if you have taken your pills. We don't know if you are taking in reality, but at least you take your pills back home, at least. We have centralized network of laboratories, and we have a follow-up of more than 20 years right now. So we have the records of 2.2 million inhabitants for 20 years of diagnosis, and we have the whole data. We have a patient folder, so they have access to prescription, diagnosis, laboratory and image, appointments. They can do the appointments I have in my mobile app, and diagnosis and prescription from private providers. So they can enter, if they go to a private hospital, if they want, they can enter the whole data in the patient folder, and they can share if they want with the public system. So how we were dealing with, that is the system, but what about the research and development and innovation? First of all, we started with a strategic framework. As I said before, we did not know why we decided to go to personalize, I would say, health. We knew that we were good in smart industry because of the business capacities. We were quite good in terms of the capacities that we had in terms of development. We were quite good in clean energy, and one of the first places in the world to produce batteries were also nearby Vitoria. So that was a company, Cegasa. And we have Ibarluzea. We have also nowadays the biggest refinery in the whole Spain, in nearby Bilbao. So clean energy was also something that we were also quite keen in terms of business capacities and in terms of knowledge. But we were not that good in health. So what to do? And on the other side, that has been the new policy that is called Berrikuntzaren Itsasargiak, that is in Basque, and that means the lighthouses of innovation. So these lighthouses on innovation. The reference networks, the reference frameworks that we have, it is the strategic plan of the Basque Health Service, the strategic plan in terms of cancer, the strategic plan on health, the strategic plan of research and innovation. And one of the things that we have done in the last 2 years, it is what we have called the Health Pact. The Health Pact has been an agreement between trade unions, professionals, managers, political parties, more or less 400 people working together in terms of what we wanted to do with health. And nowadays we have deployed almost 400 actions that need to be developed in less than 4 years. This is something that also we need to do. So what has been our concentration? First of all, digitalization and data, personalized medicine and RCTs and randomized control trials. Creating an ecosystem in reality, so we have the capacities, but they were scattered, and also research transference and practice and PPIs. This is the healthcare system and the research development and innovation system. In the very beginning, we need to say that up to the very beginning of the 80s, we were in Spain in a dictatorship. So we were not able to do almost anything. So everything started in 1985, so in which it was created the Basque Health Service. So we can say that in 40 years, we have passed from having 40 people devoted to research and development and innovation in health in the Basque Country, and we have nowadays more than 700 people. Apart from that, more and more researchers. And this is how it went. On the one side, the Basque Health System, they were created the first unit, the first health technology assessment unit to be created in Spain was in the Basque Country. It was 1992. We started also working with Finnish, with, you had in the past an organization that was called Finota. Perhaps you know that, with Marhuka Makela and some others. Now this is called FinHD, I think. So we started in 1992, but they were created different kind of institutions. So just in 40 years. And on the other side, in the related Basque ecosystem, they were created also technological centers. Nowadays we have on the one side, the Ministry for Health, a foundation that is dealing with research and innovation in health, and 4 institutions that are dealing in the provinces. One in each of the provinces, and another one that is dealing with health outcomes research. So health outcome research and other things. So planning, funding, and regulation, it is done at the ministry level. Coordination is done at the foundation level, and the research institutions, what they are doing, it is implementation of the actions. Each of those institutes are located in each of the provinces, and I will show you some figures right now, and they need to cope with more than one of the integrated services organization of the sub-regions. And this is the whole ecosystem that has been created in 40 years. We need to remember that at the very beginning of the 80s, there were just 5 companies working in healthcare sector in the Basque region. Nowadays, we have 434, just in 40 years. So we have on the one side academia. We have four universities, 1 public and the other 3 private. One of those it is Mondragon University, that is a cooperative university, so that means that is owned by the workers. Technion University, Deusto University. On the other side, we have private providers of services, so mainly hospitals, and also we have companies. We have companies that nowadays they are all together in so-called Basque Health Cluster. In the Basque Health Cluster nowadays there are 139 companies. And we have also other related institutions that are dealing with other things that we are not doing in the health organized institutes. We have Achúcarro that is doing with neurosciences, Technica that is doing with innovation and technology. It is the Basque Center for Cognition and Brain Research. It is BECAN, that is Basque Center for Applied Mathematics, with which we are nowadays working. And there is another center that is called BAIC, that is the Basque Artificial Intelligence Center. And by the way, we have one of the most developed quantum computer in the world. So there are 3 computers that are nowadays, we can say, quantum technologies 2.0. One in Japan, one in the US, and the other one in the Basque Country since October last year. How we go in terms of human resources? So nowadays we can say that there are 3,000 researchers working on healthcare sector in the Basque Country. Most of those, they are women, like in this room. So it is 61% are women and 39 are men. We have principal researchers around 400, so they have done with at least 1 research project. And mainly they are workers of the Basque Health Service. So it is 73% they are workers of the Basque Health Service. Apart from that, in terms of funding, 66% of the funding, it is competitive funding. So that means that is from sources, mainly European sources or Spanish sources. And in terms of research and research areas, we are concentrating in cancer and in neurosciences, mental health and other type of aspects. And by casualty, we don't know why we are not very keen on cardiovascular diseases, but this is something that we wanted to fix. In terms of where the alliances and collaborations, we are in most of the networks in Spain, so they are called Cyber. We are also collaborating in one of the big cohorts in Europe that is called Impact. So we wanted to have 1 million genomes in Spain, deal in less than 10 years. And in terms of doing other type and doing the follow-up of those people. That is called Impact. We are also in a platform that is called Certera. We have also the capacity to produce advanced therapies at the public sector, so it is not waiting for private companies, but it's also we can produce by ourselves, and that is the consortium Certera. In terms of other alliances, Siva, as mentioned before, the IREGA, and we had the meeting in Bilbao. So we started only 2 years ago, and nowadays we are dealing with many things, and even taking the lead in some parts. In terms of figures, we have nowadays 725 competitive projects in the healthcare sector. 60 of those, almost 60 of those, 59 of those, they are European projects. Apart from that, we have 22 projects awarded in 2025, so it is in the last year, with dealing with almost 4 million euros. We are in the European partnerships, joint actions, Horizon Europe projects. I will give you some figures. Those are the partnerships in which we collaborate on the transforming healthcare systems, in which we are leaders. Personalized medicine, in the partnership on personalized medicine, in which we deal with the financing. In brain and health, because we are quite keen on neurosciences, and also in cancer, in which we have coordinating programs of financing. Also, we are nowadays in 9 joint actions. So there's one dealing with promoting mental health, reducing the burden of cardiovascular disease, promoting interdisciplinary collaboration between countries to safeguard for effectiveness antimicrobials, and cooperation on interoperability, so that is health data. Nowadays, we are working also in a collaboration with Finland and having a MO with FinData in terms of also sharing information and technicalities. Apart from that, we will be trying to be certified to be a comprehensive cancer center for the whole region. So we will treat the whole region as a comprehensive cancer center because we have more or less the size, and we are working in palliative care for pediatric cancer patients and high quality screening programs. We are one of the highest with Finland ratios of participation in screening programs. So I think the top one in colorectal cancer is Finland and the Basque country, and also in breast cancer and other type, and cervical cancer and so on. So probably because our population is quite committed with the system and they have trust, and I think it is similar in the case of Finland. Also, we are part of the cancer mission with nowadays a project that is called Lucia. We are detecting cancers, lung cancers, and that will be the pilot for a lung cancer screening program. We are trying not to use CT scan, and that is the novelty. So we are trying to use breathing technologies. Also, we have a EU fund to primary prevention of cancer in adolescents with digital tools and healthy habits. We are running a program with 2,000 students right now. And also, we have quality of life survival in people with metastatic lung or colorectal cancer. And nowadays, we are also with the European Research Council projects, Dormatrix and MetaBasque. And this is the last one, and I think it is, for us, it is an opportunity. We have been awarded in a 26 million euros project, European project, with main companies that we wanted also to work with. Edwards, Johnson & Johnson, AbbVie Biomed, General Electric Healthcare, and also big research and development institutions. And we are part of the consortium. So it is, and this with cardiovascular disease. And probably that will be the first and the very beginning to create a comprehensive cardiovascular centers for Europe. So that will be the same as it has happened with cancer. This is the panorama. I mentioned that it was 5 companies only 40 years ago. This is the number of companies and the logos of the companies that nowadays they are based in the Basque country. Most of them, they are small and medium enterprises, but it's true that they are creating different type of things. And the healthcare sector in Basque region is collaborating with 90 of those right now in terms of prototyping, validation, and so on. So in fact, we have a program by which we help them having the validation of their prototypes in reality, in the healthcare system. And we put funds from the government in terms of doing that validation. This is how it has raised the number of companies that they are members of the Basque cluster. So nowadays, they are almost 150. This is in terms of figures. So when they started at the very beginning of the 21st century, in 1999, the GDP that they created was 0.2%. Nowadays, in 2025, it has raised to 10% of the GDP in the Basque country. So nowadays, that it was a bet to go for the biohealth. Nowadays, we are we are nowadays creating 10,000, almost 10,000 million euros in terms of revenues for the companies. Apart from that, we have created and we are less than 5% of the total population in Spain. So Spain is more or less nowadays 50 million inhabitants, but we create, in terms of the biohealthcare sector, is almost at 20% of the whole. It is Basque region. In terms of also scientific outputs, we have also increased the numbers in terms of publications. So it is in the last 5 years, we have increased almost 400 more peer-reviewed research papers, but also high quality. So that means that the knowledge it is also high. So nowadays we are in quartile 1, we have almost 65% of the papers. So that means that it's not just science, but also it is good science. And also in terms of trials, we have nowadays 900 trials open in the Basque region. Among those, they are randomized control trials. So and in the last 2 years, we have increased almost 40% the number of trials. So that means that, and they are opportunities for our citizens. They are opportunities for the sustainability of the system. So that means that we don't need to pay for that, because normally they are promoters. We receive money. And on the other side, we create opportunities also for citizens. Also, we have nowadays a single window for trials. So that means that any promoter that wants to make trials in the Basque country, they know the same door. And then we make the distribution. For us, it's easier because we have an electronic single record. So that is one. And on the other side, we deal with 2.2 million inhabitants. So that is easier. And in terms, that is protection and transferability. We have 77 developments, and 24 of those have been licensed in the last 10 years. And that is done by the Basque Foundation. We have a single entry in terms of patents and licenses for the whole system. We have also, from the very beginning, we have a health technology assessment unit that was created in 1992. I started working there some years ago. I'm not going to say how many, but some years ago I started working in health technology assessment. And another thing it is that nowadays we have an agreement with the Basque Health Cluster. So that means that health technology assessment is proactive in helping which are the rules that are going to be made in the system in terms of introducing technologies. We have a knowledge portal, so every single production of articles, projects, and everything of any single researcher are collected at the same place. So we have data. You can double check. That is also in English. So you can double check how many articles have been produced in the last week, or how many projects, or how many doctoral theses, and so on. So and that is lively data. And also, we have access to information for all the professionals. That is a meta searcher nowadays with artificial intelligence tool that we can search. You can search to all the publications that are in the world in terms of feeding with the new knowledge for health professionals. And where can we collaborate with Ostrobothnia? And that is one of the questions. I think it is by sharing knowledge, for sure, and knowledge generation, for sure. I'm always saying that it is good to know from success, but also it is good to know for bad experiences. So probably it is what not to do. It is even more interesting than what to do. And we have done many things wrong along the pathway. Sharing practices, clearly. Ecosystems, so it is how we have created that ecosystem and how it has gone, especially on the side of clusters. I've heard also that you are very keen on energy, and we have a cluster that is called Aclima, so it is climate change and energy. We have another cluster that is dealing with energy, but for me it is more important that we can share also the experience of the healthcare cluster. Apart from that, research centers, academia, for sure, and I've seen that you are doing also some economic models in which we could be interested. Also, in specific areas, we are quite good in neurosciences. psychiatry, mental health, and other areas, especially in doing mistakes. So we can share our mistakes with you, and also we can also discuss what not to do. In terms of mental health, in terms of cancer, in terms of rare diseases, I know that you are quite keen in rare diseases because of the distribution of the population and so of the Basque region. So I think we have one of the highest ratios in seronegative blood type. In my family, 80% of the family has seronegative blood type. So we are quite rare. So it is in that sense we can learn from each other. We have even 3 rare diseases that are mostly based in the Basque Country. So it is and also nowadays in cardiovascular diseases for sure. And we can also think about how to improve randomized control trials, and this is something that perhaps we can share with you. This is all the things that I wanted to say. I think it is more or less in the 30 minutes. So in Basque is said eskerrik asko. In Spanish, muchas gracias. Thank you. Kiitos, tak.
Thank you, Iñaki, for really, really interesting presentation. Do we have questions for Iñaki? There was first and then you.
Muchas gracias. Me llamo Gustavo. Yo tengo una pregunta. So I have a question.
I can say that in Basque.
You can say, yeah.
That
was much harder. So my question is regarding languages.
Yeah.
And in the Basque area, you have 3 official languages, right? Or is the French?
Yeah. We have in the Basque. In the Spanish Basque side, we have 2 official languages.
Okay.
And in the border, we have also French. Yeah.
All right. Yes. So my question is, when talking about healthcare, it's usually a very good standpoint that you get service in your own mother tongue. So how do you look to that in your region, and how do you recruit to get the right people knowing the right languages to be able to serve them in their own mother tongue?
Yeah, that is a tricky question. So it is, as I said before, one of the challenges was that up to the 80s, Basque language was forbidden. So and there was even first of all, it was considered a farmers and fishermen language much more. It was not so called in the I would say intellectual areas. So it was a big fight for recovery. It is true that there were literature and so on. So, for example, in my case, I was called by my one of my grandmas. I was called that I was a bad Basque because I was not fluent in Basque when I was born. Because during the age of my parents, it was forbidden. So my parents were not able to talk in Basque. So even when the grandmas and the grandpas, they were fluent in Basque, they were not teaching the children, or they were not talking with the children in Basque. So I was called. There are 3 words in Basque language. One it is Euskaldun Zaharra, so that means the old Basque. So they were my grandmas and grandpas. So there is called Euskaldun Zaharra, so it's the bad Basque. I was a bad Basque. and nowadays it has been a huge development in Basque education. So I think it was the same in Finland. So all the children nowadays, they are bilingual or trilingual. For example, my children are 4-lingual. So it is English, French, Spanish, and Basque. And they can change from one to the other. It is true that you were talking about talent and retaining talent and dealing with talent. One of the challenges is that in terms of the healthcare, you need to provide the healthcare in the language of the patient. And this is, in some areas, is quite challenging, because you could have C2 level or C1 level of the language, but we can say that in Basque, nowadays we have, I would say, a standardized Basque. So I can talk with anyone in any province in the Basque country. But for example, my grandma mainly was with the people in the area. So, and they did not understand the other areas in the vicinity. So we were saying that there was one Basque, and I can say that there were like 17 Basque languages. So it has been a big effort in 40 years. But one of the challenges it is nowadays is not that the people with, I would say, younger than me, around 40, so it is, they can deal with both languages without any problem. But all the people, so that means that the health professionals, mainly they speak Spanish. So it is, and that is one of the challenges, especially in community care. And also, we have been quite good in attracting talent, especially from other regions in Spain. And they say we speak one of the co-official languages. So that is enough. But if you go as primary physician to a small area, you need to deal with Basque. And it is nothing in common to Spanish. It is not like in Catalonia, in which you start from the very beginning understanding 70% of the Catalonian language if you go knowing Spanish. So this has been a challenge, especially in community care. And this is something that we are trying to deal with in terms of creating some kind of more people. But people younger than 40, most of those, they can deal in both languages without any problem.
Thank you. So then one short question.
Yes, my name is Tero Seloto. Nice to meet you. This is not such a question, it's a comment. You had one interesting Basque word in your slides, and that was europako. You mean in Finnish, euro means euro, and pako means escape. But yeah, that was interesting word. And second is and you have very many slides. In Finnish, we use the word kalvo sulkeiset. It means you had very many slides. Kalvo means slide, but sulkeiset, you need to ask some military person here what is sulkeiset in English.
Yeah.
Okay. Okay, Sofia, I need to give you one really short question.
Thank you, and thank you so much for your inspiration speech. I was just thinking about
with too many slides.
Yeah, no. But this integrated healthcare system that you have, when we also have about the same. But how big is your private healthcare sector? And do you also have occupational healthcare, like companies that have to provide healthcare for their workers?
So in terms of the public provision, more or less is 93 to 7%. So this private sector deals with 7% of the public provision. That is the fact. In terms of how many of the citizens they have double, I would say, insurance, it is around 19%. So it is 19% of the population they have private, because they wanted to go to consultation faster. Especially in dermatology, in ophthalmology, and some other specialties, they go to the private. We don't have that many, so that is quite circumstantial in comparison, for example, to Madrid or Catalonia or some other regions in Spain, Valencia, that they have more private. But probably it is because of the public sector is quite strong. And in terms of occupational health, we have one, I would say, we have a single system for reimbursement. So we have the same prices, and we share that also with occupational health care services. That means that if they go to a public hospital, they know the charges. So this and they are in need to subsidize. So they receive an invoice, and they are in need to subsidize that. So we have, I would say, public prices for different services, and this is the way.
Okay, thank you once more, Iñaki. It was really wonderful presentation. And
after 11 hours coming here.
Yes, and I think there are so many potential ideas we can collaborate together. Thank you. once more, Iñaki. And then Mika Kortelainen from THL. Tervetuloa. Okay.
Hyvää huomenta, good morning, and thanks for the invitation. I was really happy to accept this. We have had a very great collaboration, one of my best collaboration in my whole career. So I will talk about that, and I will give example on the research project that at least we think that has been successful. Hopefully others think as well. Something happened in the slides. Can you? Do you have a Acrobat reader or? Okay, I have also quite many slides. Maybe not as many, but but it would be nice to show something, at least some interesting results. So I'm maybe waiting for 2 minutes if that helps. But maybe I start with telling something about myself and our project. So I'm Mika Kortelainen. I work as a professor of health economics at University of Turku. It's a joint professorship between medical faculty and Turku School of Economics. And in addition, have been for last 3 years working as a research professor at THL, Finnish Institute for Health and Welfare. And in both of these institutes, my basically main work is to do health economic research, and my emphasis is kind of policy evaluation questions like healthcare reforms, different kind of new technologies used in social and healthcare services, and things like that. And for last 3 years, we have been working quite a lot with digital healthcare services. So as you can see here, but in other counties or regions in Finland, digital healthcare services have become very common, and very fast changes have happened within Finland in different regions, in different well-being service counties. So we now want to know whether these new services like digital clinics and services that these digital clinics provide, whether they work and what kind of benefits there are. So in this project that I'm leading, we have been studying the effects of these services, and one of our biggest kind of sub-project within this has been this collaboration with Ostrobothnia region. So we basically ran a large experiment starting spring 2025, and my aim is to, if I can get some slides, I want to show I want to show you some results. Maybe you have seen those, at least some of them, because we published the kind of first results in was it end of May this year, and that got some publicity as well. Okay, but let's start before going to the experiment or this randomized trial. Okay. Yeah, now it works. So I already said something about this project that I'm leading. So one of the project that has been important is this kind of SOTE data lab. This project was financed by Ministry of Social Affairs and Health, and the aim was really to study these new digital healthcare services. And what was the new, or we think is new about this project, is this kind of collaboration between researchers, between ministries, also with Ministry of Finance and Wellbeing service counties, and using then as recent data as possible, because the challenge with many research projects that I have been involved as well is that data is many times, at least if we talk about registered data, it's a bit old. But if you look at well-being service counties, things are happening very quickly, and we want to learn what things work and what don't work very quickly. So we basically need kind of up-to-date data, and that's why we invested, and with the funding that we got from Ministry of Social Affairs and Health, we were able to get kind of very up-to-date registered data. So that was and is still maybe one of the most important thing with this project and follow-up project as well. Another thing that has been very important is kind of evaluation. Use this real-world data to evaluate different kind of reforms, different kind of interventions, and then collaborate between, not just between ministries, but especially with well-being service counties, because they are the providers of these services, and they make decisions what kind of new services they start to implement and in which way. So we really want to know that if they implement these interventions or reforms, that what are kind of things that work well. And how to do that basically is that there are many different ways to evaluate, but the kind of optimal way is to start this collaboration, start to do research before any reform or any new technology is even implemented, because then we can affect how the reform will be done and how it can be evaluated afterwards. So what kind of things? I mentioned that there are many new changes. So we had this reform 2023, but if you look at now this Ostrobothnia region or Pirkanmaa region or any region actually, any county in Finland, there has been a lot of changes, especially regarding different kind of digital services and organization and location of services. So a lot of changes, a lot of reforms, and new technologies have been implemented. But for many of these, we don't really have a kind of evidence, and that would help to make better decision in future if we could collect this evidence as well as possible. And if we have a credible evidence, then we can make better decision, and that's why it's important to think about this before implementation, that how we could evaluate these reforms. So this kind of combining this high quality data, then with good research designs, I will talk about that soon, and then this real world implementation, these all together gives kind of opportunity to do much better research as well now than it was before social and healthcare reforms. These counties have much more power to affect how we do research. So there are a lot of opportunities, and this is the why we also started to do this thing. Okay, I mentioned already that we have been collaborating with Ostrobothnia, and we had a vision that we want to study these digital clinics and their effectiveness in Finland. And we were trying to find kind of well-being service county that would like to collaborate with our research team I was leading. And the question that we wanted to really ask, that if there is this new digital clinic, it's opened, what are its benefits, what are its costs, or what is the effectiveness of these services that are provided in this digital clinic? And then the question comes that it's more natural to evaluate this question if there's a region or county that hasn't still implemented this digital clinic. And Ostrobothnia was 2 years ago in the situation that they were planning to implement this digital clinic or planning to start this. So we we were in good time in this collaboration because at the same year we were thinking about running this experiment. So basically we started to design how to run this experiment, and we designed together, not just our research group, but all of us, this kind of population level randomized rollout that I will soon explain about details, because this is still, and I think this is internationally very unique experiment. Or I have been presenting this in many countries during the last year, and everybody are really amazed that this kind of things can be done. So I'm really proud of this experiment. So that's why I asked what made this experiment possible. Of course, there needs to be kind of real policy question that it's not just interesting for researchers, but also for people who are leading this county and who are working within county. So it needs kind of a collaboration from many sides. So management, researchers, and service developers, all of them were very important, had a very important role from early days on, basically. And this rollout was important, how to implement this rollout. That's why we want to have this randomized rollout so that we can really believe this evidence or results that we get. And then there is also kind of commitment to learn from the results. Sometimes results are not something you expect. They could be more positive or more negative, but that's always the case with this kind of experiments. So you have to kind of in advance be ready to accept any kind of results in that sense. So that's the part of this kind of trials. Okay, so to the details. So we basically started, why we want to study this question was that Ministry of Finance and Ministry of Social Affairs and Health have already for a long time thought that we can save a lot of money by investing more on digital services, because these kind of digital services can potentially substitute kind of in-person services or in-person visits, basically. So there's kind of a financial reasons to believe that why these digital services could be so important. And there are kind of two mechanisms that are kind of competing mechanisms or can affect when we talk about this digital clinic. There is this substitution that we are interested in. So if there's a new digital clinic, whether this digital care can replace more expensive traditional care, these in-person visits. Because if that's true, we can save money. We can produce these services using less money, basically. So that's the resource use. That's the health economist question why we are interested in this. On the other hand, we also know from previous research that these kind of services can increase additional demand. Because if it's become more easy to use some services through digital clinic, so that can also just increase demand. So there are these competing views, and in the end, this is kind of empirical question that which effect of this dominates in the end. So that's why that was basically the starting point of this our experiment. Okay, so we have a large experiment. That's why this is unique. So we had a almost whole. One municipality was not included in this experiment, but anyway, we basically have in the experiment 170,000 people, and this is still, to our knowledge, the largest experiment in the world on this topic, not just in Nordic countries, but we haven't found any in any other countries as well. So this is, as you know, in the Finnish primary care system, this is nurse-led digital clinic. So it's the same kind of system that other counties, starting from Päijät-Häme 2021 already, have introduced bit different kind of implementation. But that was not, we were not really affecting how this will be implemented. We were just, as researchers, we wanted to just make sure that if it's implemented, that it can be evaluated as credibly as possible. So related to that, we randomized this access to this digital clinic, not to use, but access at the household level. So half of the population, so basically 85,000 were randomized to the treatment group and 85,000 to the control group. And we had this 9 months follow-up. That was one of the first things that we discussed with Suvi and others, that what would be the kind of good follow-up. So as a researchers, we would like to have, of course, very long follow-up, but in practice, this was kind of meaningful, I think, for everybody, basically, this 9 months follow-up. Then, as I said in the beginning, that the data is important. So here we're using registered data. Usually, we wouldn't have registered data that is up to date, but because of this, our investment on this Sote Data Lab project, we basically could have a registered data that has like 1 month length, like a lag. So we can follow these different kind of outcomes, like use of the services from these administrative health records. Okay, here's if you don't know anything about this digital clinic, so it's quite small font, but here kind of descriptions how this works. So this is not just this Ostrobothnia region, but in many other regions as well. So basically, patient starts many times by answering this kind of pre-visit questionnaire first before chatting with nurse, and then when the patient chats with nurse, it can the follow-up can be that nurse gives some self-care instructions or consult physicians or direct, if needed, these patients to in-person visit to healthcare center. So these are the most typical options that happens within this digital clinic. So this is the way, and the idea is that maybe some of the people don't go to the healthcare center for in-person visits if they can handle this issue within this digital clinic or within chat. Okay, so the substitution question was the most important. So before showing any results, we actually, or even knowing the results, we implemented kind of survey among healthcare workers, among physicians and nurses and healthcare managers in Finland. So we basically, in survey, online survey, we asked a question that what you would evaluate this substitution rate to be. And now I don't have the substitution rate described here, but basically means that if you have a new digital clinic, let's say 100 digital visits more, whether these 100 more digital visits substitute 50, 100 or 0 physical in-person visits. So according to this survey, we got 300 answers. So on average, answer was that 100 new visits will substitute around 40 in-person visits. So that was the evaluation. So basically, almost half of the in-person visits will be substituted by this digital clinic. And that was the kind of evaluation that we got from the survey. So I will later compare these results to our results. So that's why I want to start with this. Okay, but before showing any results, so something how much this digital clinic was used during this 9-month period, 9-month pilot period. So only about 5% of those who were offered access used the digital clinic. That sounds small, but actually that's quite normal if we compare to other regions. It's typically between 5 and 10% and more close to 5%. So this is very typical that these digital clinics are used by less than 10% of those who have access to that. But this is enough for our purposes because we have a large region, we have a large group that we study, so even this 5% is enough. But what could affect still is that it's not just how much this is used, but also who use these services. So that's why it's important to understand that what kind of people use these digital services or open these chats in this digital clinic, basically. So we have some results on that, but I don't now go to those, but I want to show you the main results, basically, what we got from this experiment. So this digital clinic increased. We found that this digital clinic increases total contacts with limited substitution. So you can see from this graph, this uppest graph is basically showing this how much this digital clinic was used in this treatment group in this trial. So clearly, in the treatment group compared to control group, digital clinic these digital services were used much more. So that was something that we wanted to, of course, have because that's the question that we study. So the access improved. So this access improved, and it affected the use of these digital services. But more interesting are these other lines. The yellow, which I don't know how well you can see that, is this primary care contacts in total. So there's small increase in total use. And then interestingly, the third one is this in-person visits. It seems that there is a small, but very small decrease in these in-person visits. So at least based on this substitution seems to be quite minor. There is no large substitution. If you compare this first, the uppest line and the third line, so you can, by just comparing those, see that there is no kind of large substitution. Instead, there is some substitution for the fourth one, which is other traditional contacts. It means basically phone calls, healthcare need assessments, and other kind of remote contacts. So how we should interpret this? So here is the numerical interpretation on our results. So earlier I was referring to these 100 additional digital clinic contacts. So what does it mean if we compare to this or make a numerical assessment on these graphs, basically? It means that 100 new digital clinics implies about 3 fewer in-person visits. And now, if you remember the kind of survey evaluation among healthcare professionals was about 40. So substitution is clearly much lower than what was the kind of evaluation in beforehand. So basically, in-person visits were essentially unchanged. So this substitution question that we started to work with, this was maybe a bit surprising to us because we were also, as a research group, expecting larger substitution. On the other hand, if we compare to like international literature, previous literature, not these randomized trials, but kind of observational data, many studies have actually found very similar results. So in that sense, it was less surprising maybe in the end. On the other hand, we also find clear substitution. So there is substitution to these phone calls or these other remote contacts. So 100 additional digital clinic contacts implies around 40 less other traditional primary care contacts. And these other traditional are mainly phone calls, as I said. So there is at the same time not so much substitution to in-person visits, but clearly substitution to these other traditional contacts. Then, because we have this nice register data, we can also study the effects on specialized healthcare, on private healthcare services, occupational healthcare, and many different things. So we were thinking that maybe some people start to use less private healthcare services or occupational healthcare services. But we didn't find any evidence basically on that. So very small effects on all of these, also on emergency department use or any kind of hospital care. So no clear evidence on effects of this. Okay, but basically now back to this survey evaluation. So experts expected about 30 to 50% substitution, but estimated substitution was substantially lower, at least in this case. We have to remember that this was quite short pilot. It was 9 months. It is possible that this substitution could increase over longer time period, but at least during this 9-month period, this substitution was much lower. So it's close to zero, basically, this black line. So this is basically the main results in that sense, or main interesting results that you don't necessarily know in advance. Even experts don't always know what will happen. And this is kind of motivation, at least for me, why we need to run these kind of experiments, because many people believe things, but things might go differently than what our beliefs. So what did we learn? So we also learned that there are a lot of positive effects in the sense that the access improved a lot. And maybe that was not that I like it so much when these results were published, because we were trying to emphasize also these results that this digital clinic increased access, but that somehow that was not interesting for media. But clearly, so this is positive thing. So although we found a bit different substitution effects, so in the same time, as I said, there is substitution to these other traditional contacts, these other remote contacts like phone calls. But we have to anyway make understanding that maybe these potential cost savings that many people believe on, that this digitalization could bring, maybe we cannot take that automatically. So there are definitely opportunities to make savings using this new technology, but it's not that we should always think that we invest to new technology that we will automatically get these cost savings. So maybe this experiment also teaches us on that thing. But beyond this experiment, I still think, and I will say this for many times, I think that the results is not the most important thing in this experiment. The implementation and this collaboration is the most important innovation in this. Because we will have a lot of new technologies, other technologies, and AI, of course, different kind of AI applications. So I hope that this will work kind of a model that different counties could benchmark, so that if they implement some kind of AI application in healthcare or in social services, so that this kind of evaluation would be combined with this new pilot. And in this way, we could learn not just healthcare, but also social services, how to develop them in better way in the long run. So this is hopefully important lesson from this. Finally, at least this is my evaluation. I hope Suvi can complement, or others can complement this. That what did we benefit, both research group and the Wellbeing Service County, from this partnership and this experiment? So I think we really got new evidence that can be used in future, but it's still not the evidence that is the most important. It's this collaboration and this innovative way to combine people from ministry, people from county, people from academic research, and learn together and find also high quality academic evidence on this question. So hopefully this works for the next Finnish government as a model how to implement new services, how to do this kind of collaboration between academic research and well-being service counties. And I believe that this is the way that we can develop this health and social care services in future much better than we used to do before we had these well-being service counties. Okay, thank you.
Thank you, Mika, for great presentation and also for great research. I need to say that, on my opinion, this has been the best collaboration with research groups we have had, because we learned so much in so short time period, and the way your researchers acted, like your code is wrong, and then in our field, like workers on field are like, okay, we need to change the code. Okay, how should we put this one? So it was like on really rapid scale learning, and that was the best part of it. So the circle I showed in the beginning, that from research to practice and from practice to research really happened between us and between the research groups and our Wellbeing Services County. So there are lots of things to learn.
Maybe I can say one thing, so I didn't remember say it. What was the one important thing that we were discussing basically weekly, not just emailing things, but discussing mostly online, but sometimes also meeting face to face. And that's important because many times researchers are somewhere far away from those who are really doing this in practice, and that's why this maybe don't always work so well. So you need, especially for this kind of experiment, you need to speak about these things, because otherwise things can go wrong. So I think that was the very important thing, and what we learned also from this collaboration.
And we learned to know each other, so we were honest. So you didn't need to be shy, or didn't need to be like, oh, we cannot tell that you are doing this wrong. But you just could say that, no, this is not correct. We need to do it again. Okay, maybe one question, and then, then we can have a short break.
Thank you. Well, I'm so interested as I'm working with IT systems that could you find some more like positive outcomes of this? Like you are now referring to other primary visits, but people generally believe that when you make like primary care more accessible, that could affect special care. So when we, in an earlier intervention with the people's diseases could intervene, like on the primary care side, could we find some positive outcomes in the special care part?
Very good question. So I was actually thinking as in advance that we could find something like on specialized healthcare. And I think still it's possible, but maybe this was 9-month pilot. So, and in specialized healthcare, it's a bit difficult to think about what would be the best outcomes. We were looking at like hospital visits and emergency care use, but for those we didn't find anything. But it doesn't say that in the long run this couldn't be the case. So that's, I think, that's one at least aim, that you could reduce the use of like more expensive specialized healthcare, at least in some cases. Not all kind of patients it might not be the case, but at least in some cases, because if you get very fast access to services, so maybe later you don't need these more expensive services anymore. So that's at least the idea.
Okay, thank you, Mika. Now we really need to take the break. And I believe that we come back 5 to 11, eli 5:11 jatketaan pieni jalottelutauko, koska istuminen on vaarallista. need to take it one more time. Now we can't hear it, so we have
esittely Kultarannassa, joten green. Finland has a very strong foundation to build on. We have world-class medical expertise, research, and strong health technology sector overall, valuable health data, and innovative companies. These strengths really give us an opportunity to improve our health and social services while at the same time creating new growth. Hyvät ystävät, tavoitteen pitäisi ehdottomasti olla tuottaa nykyistä vaikuttavampaa hoitoa käytettävissä olevilla resursseilla. Ja sehän tarkoittaa ennen kaikkea sitä, että painopistettä siirretään ongelmien korjaamisesta niiden ennakointiin, dataa ja uusia teknologioita voidaan hyödyntää riskien tunnistamisessa aikaisemmin, palvelujen paremmassa kohdentamisessa ja ammattilaisten työn tukena. Teknologia ei kuitenkaan itsessään ratkaise soten ongelmia, se me kaikki tiedetään. Jos uusi digitaalinen palvelu tai tekoälyratkaisu esimerkiksi vain lisätään vanhan toimintamallin päälle, kustannukset voivat jopa kasvaa. Eli todellinen hyöty syntyy vasta silloin, kun samalla uudistetaan palveluprosesseja, työnjakoa ja myös tapaa tehdä työtä. Uuden pitäisi myös pystyä korvaamaan vanhaa. Tässä on samalla erittäin suuri mahdollisuus suomalaiselle innovaatiopolitiikalle laajemminkin. Julkinen sosiaali- ja terveydenhuolto tarjoaa merkittävän ympäristön uusien hoitojen, diagnostiikan, tekoälysovellusten ja terveysteknologian kehittämiselle ja käyttöönotolle. Tätä mahdollisuutta meidän pitäisi hyödyntää nykyistä huomattavasti paljon paremmin. Myös lääketeollisuus panostaa Suomessa voimakkaasti tutkimukseen ja innovaatioihin, ja tulokset alkavat näkyä. Ala investoi viime vuonna Suomeen yli 500 miljardia euroa, ja investointien odotetaan kasvavan edelleen. Tämä on erityisen myönteistä, sillä lääketeollisuus rakentuu juuri niiden vahvuuksien varaan, joista Suomi tunnetaan ja joista tälläkin viikolla ollaan paljon eri yhteyksissä puhuttu, eli maailmanluokan tutkimus, korkea osaaminen ja kyky jalostaa innovaatiot uusiksi tuotteiksi ja hoidoiksi. The pharmaceutical industry is also investing heavily in research and innovation in Finland, and we are beginning to see the results. The sector has invested more than €500 million in Finland last year, and investments are expected to continue to grow. This is particularly encouraging because the pharmaceutical industry builds on the very strengths Finland is known for: world-class research, highly skilled people, and the ability to turn innovation into new products and treatments for the benefit of the people. Hyvät ystävät, yksikään yritys, hyvinvointialue tai julkinen toimija ei yksin pysty rakentamaan kaikkia niitä ratkaisuja, joita tulevaisuuden terveydenhuolto tarvitsee, ja siksi tarvitsemme ehdottomasti vahvempaa ekosysteemiajattelua, juuri sitä, mitä tässä nyt tänään käsittelette ja tätä aloitetta. Julkisen sektorin, yritysten, tutkimuksen ja terveydenhuollon ammattilaisten pitäisi kehittää ratkaisuja nykyistä huomattavasti tiiviimmin yhdessä, ja lähtökohdan on oltava todellinen tarve, mikä ongelma halutaan ratkaista ja millaista mitattavaa hyötyä ratkaisusta syntyy potilaalle ja koko järjestelmälle. Julkinen sektori voi myös mahdollistaa kehittämisen, kokeilut ja uusien ratkaisujen käyttöönoton. Tämä on tärkeää myös yritysten kasvun kannalta. Suomessa kehitetty innovaatio tarvitsee aina sen ensimmäisen käyttäjän. Kun yritys pystyy kehittämään ratkaisua yhdessä terveydenhuollon kanssa, osoittamaan sen vaikuttavuuden ja saamaan kotimaisen referenssin, sillä on huomattavasti paremmat edellytykset kasvaa myös kansainvälisesti. Samanlainen ajattelu pitäisi ulottaa laajemminkin terveysalan innovaatioihin. Tästä ollaan puhuttu paljon tällä viikolla muun muassa energia- ja datatalouden osalta, ja nämä samat lainalaisuudet ja mahdollisuudet voidaan hyödyntää myös terveydenhoitosektorilla, ja myös siitä näkökulmasta olemme erittäin iloisia tästä teidän aloitteestanne. Eli meidän pitäisi siirtyä yksittäisistä hankkeista ja kokeiluista pitkäjänteisempiin kumppanuuksiin. Parhaimmillaan julkisella sektorilla ja yrityksillä on yhteinen tavoite: parempi hoitotulos, sujuvampi palvelu tai ammattilaisten ajan vapautuminen. Myös kannustimet pitäisi siis rakentaa niin, että onnistumisesta hyötyvät kaikki osapuolet. Tässä myös terveysdata on yksi Suomen merkittävimmistä vahvuuksista. Tätä kehitystä on tällä hallituskaudella myös määrätietoisesti viety eteenpäin. Olemme käynnistäneet terveys- ja hyvinvointialan kasvuohjelman, jonka tavoitteena on vahvistaa alan tutkimusta, innovaatioita, investointeja ja yritysten kansainvälistä kasvua. Samalla olemme rakentaneet yhtenäisempää mallia hyvinvointialueiden ja yritysten innovaatioyhteistyölle. Tavoitteena siis on, että hyviä ratkaisuja voidaan kehittää, kokeilla ja ottaa käyttöön nykyistä sujuvammin, eikä yhteistyö jäisi yksittäisten hankkeiden varaan. Myös yksi Suomen suurimmista vahvuuksista, terveysdata, on saatava nykyistä paremmin käyttöön. Toisiolakia on uudistettu tutkimuksen ja innovaatiotoiminnan edellytysten parantamiseksi ja samalla Suomi rakentaa eurooppalaista terveystietoaluetta. Olemme myös selkeyttämässä lääketieteellisen tutkimuksen lainsäädäntöä, jotta Suomi olisi entistä houkuttelevampi paikka tutkimukselle ja investoinneille. Tavoite on lopulta hyvin konkreettinen. Suomessa tehtävä korkeatasoinen tutkimus ja osaaminen johtaisivat nykyistä useammin uusiin hoitoihin, innovaatioihin ja kasvaviin yrityksiin, ja että nämä ratkaisut pääsisivät käyttöön myös suomalaisessa terveydenhuollossa. Joten juuri tällaista yhteistyötä ja ekosysteemiä meidän kannattaa Suomessa rakentaa. Olen erittäin iloinen, että juuri Pohjanmaan hyvinvointialue on tässäkin asiassa pioneeri. Oli upea nähdä myös tämä JHL:n tutkimus, jossa Vaasa mainittiin koko Hesarin sivulla Suomen toiseksi parhaimpana kuntana. Erinomaista työtä olette tehneet siellä omalta osaltanne. Ibland är det så bästa vänner också att anfallet bästa försvar. När man själv tänker tillbaka på de första åren i riksdagen och den kamp vi och ni tillsammans förde för fullsjouren vid Vasa centralsjukhus, så jag är 100% övertygad om att när vi nu tar sikte mot ännu högre ambitionsnivåer så kommer vi på sikt också att ha ett universitetssjukhus i Vasa, inte imorgon, men tack vare det här arbetet ni idag sparkar igång så kommer vi åtminstone att ha ett starkt centralsjukhus också de kommande åren. Lämmin kiitos teille kaikille, jotka olette tässä mukana. Erityiskiitos Anne, Marina, Suvi ja kaikki muut. Olen omalta osaltani valmis tietenkin auttamaan kaikin keinoin. Oikein mukavaa päivää sinne. Tack, vi håller kontakt.
No niin, kiitos Joakim. Ja seuraavaksi me saadaan Vaasan yliopistosta professori Harri Jalonen. Me ollaan tehty myöskin Vaasan yliopiston kanssa erittäin menestyksekästä yhteistyötä niin tutkimuksen kuin kehittämisen osalta jo useiden vuosien aikana. Ja Harri tulee nyt vähän kertoa siitä, että mitä se nyt on sitten, että miten sitä on tehty ja miten me voitaisiin jatkossa tehdä vielä paremmin. Miten tutkimuksesta päästään käytäntöön ja käytännöstä tutkimukseen. Ole hyvä, Harri.
Hyvää aamupäivää myös mun puolestani. Mä oon tuossa eturivissä hieman kärvistellyt ja vaihtanut asentoa vähän väliin, ja se johtuu siitä, että minulle sattui pieni tapaturma pari viikkoa sitten ja epäilen, että minun häntäluuni on murtunut, mistä johtuu sitten se, että on hakenut aina vähän parempaa asentoa. Se on aiheuttanut sitten selkään sellaisen jonkinlaisen ongelman, että ei oikein tahdo tietää miten päin olisi. Suvi ei ole täällä korkokengissä sen takia, että ne olivat eri paria. Minä tuosta syystä jätin omat korkokenkäni kotiin. Kuten Suvi totesi, niin ollaan tehty yhteistyötä Vaasan yliopiston ja Pohjanmaan hyvinvointialueen kanssa jo useamman vuoden ajan. Ja mä täältä katson yleisöä, niin aika moni on joutunut tämän yhteistyön uhriksi. Teitä on haastateltu, te olette vastanneet kyselyihin, te olette istuneet työpajoissa tai jotakin muuta vastaavaa. Kiitos teidän panostuksestanne, koska ilman sitä tietenkään meidän tutkimuksesta ei tulisi oikeastaan yhtään mitään. Edustan siis Vaasan yliopiston sosiaali- ja terveyshallintotiedettä. Me ollaan pieni tiivis tiimi, 20 ihmistä, 40 maisteria valmistuu vuosittain, vähän vuodesta riippuen 2-4 tohtoria. Mä edustan aika paljon soveltavaa tutkimusta. Perustutkimus on se toinen tutkimuksen tekemisen tapa, jossa ei välttämättä oikeastaan aina tiedetä, mihin käytäntöön jokin tutkimus oikeastaan liittyykään. Me edustetaan aika selkeästi sen tyyppistä lähestymistapaa tutkimukseen, että meillä on joku tietty käytännöllinen yhteys meidän tutkimustyöllämme. On ollut kiva Pohjanmaan hyvinvointialueen kanssa tehdä yhteistyötä johtuen muun muassa siitä, että kun ollaan valmisteltu esimerkiksi strategisen tutkimusneuvoston hankkeita tai jotakin muuta vastaavaa, niin toisin kuin monissa muissa tutkimusorganisaatioissa, niin aika usein siellä hankevalmistelun aikana pohditaan, että mitäs käytännön kumppaneita me sitten tässä niin kuin saadaankaan mukaan, niin se on kiva huutaa Zoomissa tai Teamsissa, että Pohjanmaa on ainakin mukana. Tästä on lupaus Marinalta ja Suvilta, kiitos siitä. Tässä omassa esityksessäni niin tosiaan pohdiskelen vähän, yritän kehystää hieman tällaista käytännön ja tutkimuksen välistä yhteistyötä. Me tutkijat kovin usein peräänkuulutamme ja haluamme lisää rahoitusta tutkimukselle, niin minäkin. Se on kiva, jos on rahaa, jolla tutkia. Me myös kovin usein peräänkuulutamme, että pitää tehdä enemmän tutkimusta, niin minäkin. Mutta sitten toisaalta on myös hyvä joskus kysyä, että onko se tutkimuksen määrä vai onko se kysymys sitten siitä tiedonmuodostuksen laadusta. Mika Kortelainen tuossa omassa puheenvuorossaan loppupuolella toi mielestäni tärkeän oivalluksen, mikä Turun yliopiston THL ja Pohjanmaan hyvinvointialueen välisessä yhteistyössä on ollut. Toki se, että syntyy näyttötietoa, syntyy näyttöä jonkin intervention vaikuttavuudesta ja näin, mutta yhtä tärkeää ja jossain tapauksessa tärkeämpää on myös yhdessä tekeminen, yhdessä oppiminen. Se nimittäin saattaa muuttaa ajattelua, ja ajatteluhan sen pitäisi jollakin tavalla sitten näkyä toiminnassa. Kun katsotaan, mitä oikeastaan sitten vaan tutkimus oikeastaan onkaan, niin tutkimuksessa pyritään tuottamaan tietoa. Perusjännite, mikä tutkimuksen tuottamisen ja sen hyödyntämisen välillä on aikajänne. Tutkimus on nopeimmillaankin pirun hidasta. Jos ajatellaan, että tutkimus ikään kuin valmistuu tai tulokset valmistuvat tai tieto syntyy siinä vaiheessa, kun tiedeyhteisö on vertaisarvioinut artikkelikäsikirjoituksen, niin se on aika pitkä aika, joka kuluu siitä, tehdään tutkimusta ja saadaan tutkimuksen tulokset julkaistua. Puhutaan vuosista. Käytännössä tarve on usein paljon nopeampi. Pitäisi ymmärtää, onko tällä toimenpiteellä, mitä me teemme, onko sillä jotakin vaikutusta siihen suuntaan, mitä me haluamme ja näin poispäin. Voidaan vertauskuvallisesti puhua, että tiedon tuotanto on pataruokaa, tiedon tarvitsijat odottavat pikaruokaa. Tutkimus on harvoin sellaista, että me tuotetaan ikään kuin ruiskulla jokin oivallus ja sitten käytäntö muuttuu. Joissain tapauksissa näin voi käydä, mutta uskallan esittää, että se on ehkä kuitenkin harvinaisempaa, aika harvinaista. Mä olen viime aikoina lueskellut erilaisia teoksia ja ihastunut jollakin tavalla ranskalaisen muutaman vuosi sitten edesmenneen Bruno Latourin ajatuksiin. Latourhan oli kuuluisa tieteen sosiologi ja filosofi ja sitten politiikan tutkimuksen professori ranskalaisessa yliopistossa Sciences Po yliopistossa ja näin poispäin. Hänellä on tietysti monenlaisia kiinnostavia ajatuksia, mutta yksi, joka on erityisesti itseäni jollakin tavalla viehättynyt viime aikoina, on se, että millä tavalla syntyy totuus tai uusi tieto tai joku ymmärrys. Ja Latourilla on käsite kääntäminen tai käännöstyö, translation. Ja hänen perusargumenttinsa on, että kun jokin asia siirtyy toimijalta toiselle, se muuttuu siinä matkan varrella. Tämän soveltaminen tutkimuksen ja käytännön väliseen yhteistyöhön tarkoittaa nähdäkseni sitä, että kun tutkimuksessa tuotetaan tietoa, se ei sellaisenaan koskaan mene käytäntöön. Sitä tulkitaan, sitä sovitetaan kulloisenkin kontekstiin, se muuttuu siinä matkan varrella. Joskus tutkimustieto muuttuu poliittiseksi argumentiksi, joskus se muuttuu ongelman määrittelyksi, joskus se muuttuu budjettiperusteluksi. Mikan ja kumppaneiden aivan mahtava tutkimus, jossa tutkittiin digitaalisten palveluiden suhdetta kasvokkain tapahtuvaan palveluun, on hyvä esimerkki tiedosta, joka periaatteessa pitäisi ikään kuin puhutella. Se on näyttö, hyvällä satunnaistetulla asetelmalla rakennettu ymmärrys. Mä veikkaan, että sitten kun ryhdytään esimerkiksi hyvinvointialueen poliittisessa päätöksenteossa pohtimaan näitä asioita, se muuttuu aika lailla matkan varrella. Voi olla, että halutaan pitää kiinni esimerkiksi oman kylän tai oman alueen terveysasemasta ja näin poispäin. Mä esitän 3 teesiä. Ensimmäinen teesi on, että tutkimus alkaa siitä, että joku huomaa käytännössä jonkin ilmiön, mutta ei ehkä kykene selittämään tai ymmärtämään sitä. Joku toimii, joku ei toimi, joku muuttuu, joku huolestuttaa. Tutkimus, joka rakentuu tämän tyyppisen ikään kuin hämmästelyn pohjalle, mä väitän, että on jo hyvä, tai se on hyvä pohja sille, että myös ne tutkimuksen tulokset vaikuttavat käytännössä johonkin. Toinen teesi, tutkimus auttaa organisaatioita oppimaan. Ratkomaan ongelmia, näkemään vaihtoehtoja, problematisoimaan niitä ja näin poispäin. Tämä oli mielestäni myös yksi keskeinen Mikan esityksen sisältö. Kysymys ei välttämättä ole siitä, että tutkijat kertovat, että mikä toimii, mitä pitää tehdä, vaan tietyllä tavalla auttavat esimerkiksi kehystämään ongelmia, auttavat organisaatioita oppimaan, auttavat organisaatioita hahmottamaan käsillä olevaa asiaa jollakin tavalla uudesta ja mahdollisesti paremmasta näkökulmasta. 3. teesi, että toimintaympäristö muuttuu koko ajan. Teknologiat kehittyvät, lääketiede kehittyy, taloudelliset reunaehdot muuttuvat ja niin poispäin. Kysymys ei ole välttämättä siitä, että tutkimus auttaa ikään kuin poistamaan sitä epävarmuutta, mikä syntyy toimintaympäristön muutosten kautta, vaan ehkä ennemminkin auttaa hyvinvointialueita ja muitakin organisaatioita sietämään sitä epävarmuutta, tulkitsemaan epävarmuutta. Kun me tarkastellaan näiden kolmen näkökulman kautta tutkimuksen ja käytännön välistä yhteistyötä, niin voidaan esittää tämän tyyppinen ajatus, että tiedon muodostus lähtee siitä, että eka on ensiksi on niin yksilöllistä merkityksenantoa, on kysymys sitten johtajasta, asiantuntijasta tai kenestä tahansa. Organisaatioiden kohdalla kysymys on aina strategioiden, rakenteiden ja käytäntöjen muuttumisesta. Ja sitten tämä konteksti, joka on aika kompleksinen, se institutionaalinen kompleksisuus, siihen liittyvät kaikki yhteiskunnalliset muutokset. Mä ajattelen sillä tavalla yliopiston ja hyvinvointialueen välistä yhteistyötä, että kun me onnistutaan yhdessä hahmottamaan niitä ongelmia, yhdessä hahmottamaan mahdollisia ratkaisuehdotuksia ja yhdessä pohtimaan, mitä tutkimustulokset, itse tehdyt tutkimukset ja muiden tehdyt tutkimukset viime kädessä tarkoittavat jossakin tietyssä kontekstissa, niin silloin me voidaan puhua jostakin sellaisesta, joka muuttaa myös käytännössä toimintaa. Hieman yksinkertaistaen yliopisto tuo teoreettista ymmärrystä, menetelmällistä osaamista ja usein myös sitä kansainvälistä uusinta tietoa. Hyvinvointialueen tehtävänä on tuoda siihen pöytään nyt käytännön ongelmia, sitä kokemusta, toimintaympäristön tuntemusta ja myös sitä mahdollisuuden kokeilla uusia ratkaisuja. Ja juuri tämä mahdollisuuden kokeilla uusia ratkaisuja on mielestäni aika lailla tavallaan se punainen lanka myös, mitä me tänään tässä ollaan aamupäivän aikana eri näkökulmista vähän tarkasteltu. Lopuksi yhdenlainen tulkinta. Me voidaan ajatella, tai kun mä pohdin, että mitä kaikkea me ollaan tehty tässä vuosien aikana nyt Pohjanmaan hyvinvointialueen kanssa, niin meillä on erilaisia tutkimusinterventioita eri tasoilla. Välillä liikutaan makrotasolla, pohditaan, että millä tavalla esimerkiksi makrotasolla tapahtuvat muutokset, ohjauksessa tapahtuvat muutokset, millä tavalla ne vaikuttavat hyvinvointialueen toimintaedellytyksiin. Ollaan tarkasteltu mesotasolla, eli niitä hyvinvointialueen toimintakäytäntöjä, rakenteita, prosesseja, johtamista, etc. Ja välillä menty sitten ihan tuolle mikrotasolle, jossa sitten ikään kuin palvelusysteemi ja kansalaiset ja asiakkaat kohtaavat, missä ehkä sitten tapahtuu sitä arvon luomista. Ihan muutama esimerkki. Keväällä tarkastettiin Riikka Lehesvuon väitöstutkimus otsikolla systeeminen näkökulma terveydenhuollon potilasturvallisuuteen. On hyvä esimerkki tutkimuksesta, jossa pyritään ymmärtämään hallintotieteellisestä näkökulmasta potilasturvallisuuden edellytyksiä. Me olemme tehneet tutkimusta Pohjanmaan hyvinvointialueen päätöksenteko- ja johtamisjärjestelmästä ennen kaikkea, millä tavalla virkajohto ja luottamushenkilöjohdon yhteispeli toimii, erityisesti hallitustyöskentelyä olemme arvioineet. Tässä pari esimerkkiä, jotka on tässä vuosien varrella toteutettu. Ehkä viimeisenä huomiona vielä parhaillaankin meneillään oleva tutkimus, jossa me pyritään vähän ymmärtämään vaikuttavuuden problematiikkaa vähän eri tavalla kuin Mika ja kumppanit. Me ollaan haastattelemassa tällä hetkellä, ollaan haastateltu jo hyvinvointialueen johtoa, esihenkilöitä. Tällä hetkellä haastattelurundi pyörii ikään kuin ruohonjuuritasolla ja pyritään ymmärtämään, että miten eri organisaatiotasoilla ymmärretään sosiaali- ja terveyspalveluihin liittyvää vaikuttavuutta. Ja taas siellä taustalla ajatuksena on se, että jos me ymmärrämme paremmin, millä tavalla esimerkiksi vaikuttavuuteen eri toimijat suhtautuvat, niin se auttaa ehkä meitä ymmärtämään hieman paremmin myös sitten sitä, että millä tavalla vaikuttavuutta voidaan käytännössä johtaa. Pelkästään tällä meidän tutkimuksella asiaa ei voida ratkaista. Me tarvitsemme Mikan ja kumppaneiden kaltaisia erilaisia lähestymistapoja tutkimukseen. Mutta näin lyhykäisyydessään yliopiston ja Pohjanmaan hyvinvointialueen välistä yhteistyötä. Mä uskon vilpittömästi siihen, että kun me ymmärretään paremmin, tai kun tutkimus auttaa ymmärtämään niin kuin käytäntöä itseään paremmin, ja sitten käytäntö auttaa sitten taas vastaavasti tutkimusta kysymään niitä parempia kysymyksiä, niin voi syntyä jotakin sellaista vaikuttavuutta, jota kumpikaan osapuoli ei voi yksinään saavuttaa. Minä kiitän.
Kiitos Harri. Oho, nyt vähän kauemmas mikkiä. Yksi kysymys. Jos jollakin on yksi tiivis kysymys, niin voidaan tähän kohtaan ottaa.
Kiitos. Tämä piti ollakin kaukana. Ei ehkä kysymys, mutta ehkä enemmän vaan kommentti. Kiitos hyvästä esityksestä. Me elämme maailmassa, jossa koetaan, että vain muutos on tarpeen. Ja toisaalta on myös hirveän tärkeää löytää ne asiat, jotka on jo, uskallan sanoa, valmiita. Et nythän me muutetaan asioita muuttamisen takia ehtimättä miettimään, että onko se muutos itse asiassa tarpeen. Eli tätä varmasti myös meillä silloin, kun me asiakaspalveluprosessia mietitään, että ei ainakaan kauhean kiireellä vaan muutoksen takia muuteta.
Tuo on muuta vaikea sanoa, kun näinhän se on. Ei pidä heittää lasta pesuveden mukana, niin kuin sanontakin kuuluu.
Hyvä, kiitos Harri. Sitten meidän viimeinen puhuja Helsingin yliopiston Sosso-komista, rehtori Petra Kouvonen. Me ollaan aloitettu erittäin lupaavaa yhteistyötä ja jag är så tacksam att du kom idag. Så varsågod Petra.
Tack så mycket Suvi, och jag har blivit ombedd att tala svenska, men jag har mina slides på engelska så det ska säkert funka bra. För det första så vill jag tacka organisatörerna. Det är hemskt sällan som man kommer till en konferens var det känns liksom att allt som man sitter och hör är liksom sådär att yes, det har jag väntat på. Och lite så känns det faktiskt. Jag kommer från alltså Svenska social- och kommunalhögskolan Sosso-kom som är en fristående enhet vid Helsingfors universitet. Vi har mångdisciplinär utbildning och forskning på olika samhällsdiscipliner. Jag har jobbat där nu i 2 år. Men före det och också parallellt nu så är jag alltså engagerad i implementationsforskning, så att jag har varit väldigt lycklig när jag har hört många av de här presentationerna. Och på något sätt så börjar det liksom bli en bild i huvudet på mig att allt det här som vi talar om här idag så behöver faktiskt alla de aktörer som har nämnts här också för att vi ska kunna jobba tillsammans och skapa någonting nytt i en värld som är ganska kaotisk ibland. Jag själv har forskat i implementeringen av interventioner, psykosociala interventioner, som är på det sättet spännande att de används av många olika aktörer. Och precis som här tidigare sades, så fast man har tanken om att någonting ska göras på ett visst sätt,
så blir verkligheten helt en annan. Och därför tycker jag att det här som också Mika tog upp med att vi borde inte gå ut och massivt implementera innan vi vet lite vad vi gör. Det här kanske som en introduktion av mig själv. Idag ska jag tala om socialt arbete. Och nu när vi talar om sote så glömmer man lätt det där så. Man pratar bara om det. Och det där, och jag vet att det beror på många olika saker. Det beror på strukturer, det beror på traditioner och så vidare. Men jag försöker ha en sån approach att hur skulle vi kunna nu se att det finns en möjlighet. Och om vi tänker på den situation vi nu har så är den ju helt ny. Vi har någonting som universitetssjukhus. Och därför kommer min universitetssjukhus på hälsosidan, vilket vi inte har på den sociala sidan. Vilket betyder att de här nya välfärdsområdena är en helt ny roll. Jag kommer att säga några ord om det. Jag kommer också att tala om förutsättningar men också kanske hinder för samarbete som är viktiga att förstå, som har att göra med vår förståelse av kunskap. Så kommer jag säga någonting om implementering och implementeringsforskning, varför det är ett viktigt centralt element. Men sen framför allt det som är rubrik också ska handla om är det att hur ett regionalt samarbete som vi då har inlett så kan dra nytta av de här olika aktörerna och var vi är nu i den processen. Men allra först ett par ord om det här med de här nya välfärdsområdena som nu ändå är relativt nya ännu. Vi har ju en förståelse för att vi har olika typer av komplexa problem och då behöver vi också strukturer som sköter om att de här problemen på något sätt utforskas och att man kan ha en kontakt med praktiken. Det här har på många sätt kanske hittills saknats. Och nu har vi, som vi hörde här tidigare också, så har vi en möjlighet att på ett helt annat sätt få data och som underlag för beslutsfattande, för implementering och för uppföljning. På det sättet så tycker jag att det här Living Lab är ett jättebra koncept för att vi har ett område, en miljö där vi kan forska i, men sen samtidigt så har vi också en struktur. Det vill säga vi har nu en aktör och det är välfärdsområde som också täcker det sociala området. För att hittills så har det ju varit så att på universitetssjukhusen så har vi ofta anställda och sådana som sitter i ledningsgrupper som har en fot i universitetet och så har de en fot som praktiserande överläkare till exempel. Den här strukturen saknas då på den sociala sidan. Och därför så har vi då en möjlighet att nu utnyttja det här med välfärdsområdena som en struktur. Men, här kommer det stora men. Och det var också Harri inne på här tidigare. Vi kan inte göra det utan att vi också har då med akademiska partners. Och där kommer då vi in. Med en massa andra partners förstås. Varför, om vi tänker utöver det här organisatoriska landskapet, så varför har det ibland kanske varit svårt också att jobba och hitta den där gemensamma vinkeln? Så är ju helt från paradigmet. Om man tänker på hur man ser på evidens, så i den medicinska världen så utgör man gör en forskning i ett laboratorium för att nu riktigt karikera, och sen för man ut den innovationen i världen och tänker att den ska fungera där. Och då har man liksom tappat på sätt och vis redan någonting på vägen, för alla verkligheter ser ju olika ut. Sen igen när vi kommer till hur man forskar i det sociala kontexten och tänker på olika utmaningar och problem, så där ser man mycket mer på hela omgivningen och på allt det som kommer in i att man är i en verklig miljö. Det som man kanske inte alltid kommer ihåg, att de här två paradigmen har nog kommit, och det hör man ju idag också när man lyssnar på hur det talas här, så har kommit mycket närmare varandra. Det är inte mera så att det finns liksom interventioner som fungerar bara för ett enda problem, och att man på den medicinska sidan skulle tänka naivt att den fungerar i praktiken. Utan det är nog så att allt mera så tar man i beaktande att det finns en komplex verklighet, och det finns verktyg för hur man kan anpassa, adaptera och så vidare. Det vill säga man har mycket längre kommit in på det. På den sociala sidan har man börjat se att det finns jättebra mycket att lära sig också från det, att man tittar på vad man håller på och liksom försöka lösa och dokumentera det för att sen kunna också skala upp. Och det här är någonting som pågår. Här finns ett exempel på ett sånt här framework som man har jobbat fram. Och också i det här projektet var jag är med, så jobbar vi med att titta på olika nivåer hur den komplexa verkligheten kommer in. Och om man tänker på det här processen som det ju är, så har vi alltid den här första fasen som inte ska glömmas bort. Och det är just där som man borde tänka på vad är det vi tänker att vi vill åstadkomma. Vad har vi för gemensam målsättning med vår verksamhet? Och då kunna göra till exempel sådana första studier som man sen tittar, vad gick fel, vad borde vi ändra, vad skulle man kunna göra annorlunda. Och det kan man inte göra utan det där samarbetet och den där dialogen som man har tillsammans. Jag tänkte att jag tar ett sådant här exempel förrän jag går sen till vad vi har här framför oss och vad vi funderar på tillsammans med Österbottens välfärdsområde. Jag var i Kanada för några år sedan och jag har ännu samarbete med vissa forskare där som hade ett väldigt innovativt sätt att tänka på psykosociala problem som också kan ha medicinska dimensioner. Och de jobbar fram sätt att jobba, vad man definierar problem. Och någon var inne på, jag tycker vi fick en fråga också om det, att vi kan ha problem som landar på den här specialistvården när den vi borde komma in mycket tidigare. Och de hade ett sådant problem med sin HIV-population där de hade en dyr vård. De vårdade de här patienterna i specialistvården och de ville få pendeln vänd så att de skulle kunna börja komma in tidigare. Och då jobbade de fram på ett väldigt innovativt sätt koncept där de till exempel gjorde olika sådana, de definierade vad de hade för problem för det första och sen gjorde de studier, gick igenom litteratur, gick igenom det vad de hade och så presenterade de den här evidensen i olika paneler och också diskuterade med de som jobbar på fältet. Och deras målsättning var att egentligen det som Harri var inne på, den här translation, att försöka hitta en slags gemensam förståelse. Kanske inte vara helt av samma åsikt, men ha en gemensam förståelse för vad är det som bör göras. Och sen efter det kom de till det här, vad är den bästa tillgängliga kunskapen vi har, hur ska vi göra det? Och så byggde man upp igen ett lärande element. Och de lyckades få alltså den här vården att på lång sikt sen förflytta sig. Vi är inte riktigt där ännu, men alltså det som vi är igång med här på välfärdsområdet tillsammans så kom och förhoppningsvis också med andra aktörer är det att vi har då ringa in och definiera tillsammans att vi har en utmaning och det är det att socialt arbete kommer att behöva inom loppet av en kort tid kvalificerad arbetskraft här i Österbotten mera än på annat håll. Det finns inte tillräckligt med svenskspråkiga socialarbetare och även om den här situationen hela tiden ändrar så har jag gjort en liten sån här analog till det att då i tiderna så hade vi lärarutbildning i Vaasa, och då klagar vi hemskt mycket på i Nyland att vi har inga lärare där nere. Och det där lite på samma sätt nu, så var det här någonting som startar vår diskussion. Och samtidigt så har vi då det nationella ansvaret för att utbilda socialarbetare och på svenska tillsammans med statsvetenskapliga fakulteten vid Helsingfors universitet. Och då kom vi ganska fort till att det här bör ju på något sätt nu åtgärdas. Och tillsammans med välfärdsområdet så har vi gjort ett intentionsavtal för en ganska kort tid sedan, det vill säga 2025, om att vi försöker etablera en professur i socialt arbete här, och att vi ska kunna liksom både då utbilda och forska inom socialt arbete. Och för oss så ser vi det liksom som en jättefin möjlighet att nå ut bredare i svensk Finland, och sen för välfärdsområdet så förhoppningsvis kan vi vara sen en av de här partners som kommer in och ger den här forskningen, och också på annat sätt hämtar in sen liksom know-how. Och det som vi tänker att vi vinner på det dessutom är ju förstås det här att vi har en empirisk miljö som är ganska unik. Alltså välfärdsområdet i Österbotten är ju det enda som har svenska som majoritetsspråk. Så det som vi lär oss här, de koncept vi lär oss här och det resultat vi får, så kan vi använda också på annat håll. Så det som vi är ute efter är att skapa ett kollaborativt nätverk som ska bidra förstås i första hand till regionen, men då i vårt fall så handlar det ju om socialt arbete som forskning och som utbildning. Och så tänker vi också att det här på samma gång då kan stärka det sociala arbetets akademiska profil. För att vi ser att den här, som jag var inne på alldeles i början, att det här att vi har ganska hotad existens jämfört med hälsoområdet är mycket att vi har inte finansieringskanaler, och våra partnerskap skulle kräva liksom mera. Vi skulle ha mycket att lära av varandra, och vi skulle också behöva det här samarbetet. Så att det tänker vi förstås att det är viktigt. Och sen det här att vi skulle få ett utbud av svenskspråkiga socialarbetare med hög kvalitet i fortsättningen också i Österbotten, men som kan tjäna då vidare i samhället också. Och det som vi gör är ju att vi tänker att vi inte gör det här ensam, utan att naturligtvis tillsammans med andra akademiska aktörer. Och det är särskilt nu när man tänker då på att vi ska ha utbildning, så betyder det ju att det är jätteviktigt att här finns aktörer som vi kan jobba med. Och det kommer att vara ett naturligt steg, nästa steg. Det första steget vi har tagit är det att vi har försökt få ihop finansiering till en professur för att det ska kunna vara en stark kvalitet och bygga upp miljön kring det. Vi verkar i Ekgården redan nu. Vi har ju en lång tradition av att utbilda socialarbetare här uppe i Vaasa, så att vi har också samarbete med juridiska fakulteten. Och på det sättet så finns det liksom en startpunkt, kan man säga. Och nu som det ser ut så är välfärdsområdet och flera andra aktörer med, så att vi under hösten kommer att kunna gå vidare med den här professuren. Och det liksom har varit det första. Och det betyder att då vågar man börja satsa på att bygga det här nätverket också. Och där kommer då in det här samarbetet med alla andra aktörer, och det här hur vi kan fundera på det här Österbottens välfärdsområde som en sån här living lab med en komplex realitet. Och precis som här var nu tidigare kom fram, som det där Mika också var inne på, att egentligen är det inte de här enskilda studierna, utan jag tänker också att vi bygger upp nya väg att fundera på hur vi kan inkludera medborgare, de som beslutsfattare och de som jobbar med de här frågorna. Hur använda evidens på ett sådant sätt att vi kan få bättre resultat i framtiden. Tusen tack för min del.
Kiitos. Kiitos Petra Tässä te nyt kuulitte, että mitä nämä ensiaskeleet on. Aika huikealta näyttää nämä meidän yhteistyön mahdollisuudet, kun me uskalletaan edetä rohkeasti. Mä luulen, että meillä on itse asiassa aikaa yhdelle kysymykselle Petralle. Tuleeko nopeasti? Jos ei, niin sitten me mennään eteenpäin. Tutko Anne mun kanssa vielä tänne eteen? Yksi aikaisemmin. Jep. Okei. On tullut viimeisen slaidin aika. Eli miten tästä eteenpäin? Ihan ensimmäisenä me halutaan kutsua kaikki mahdolliset kiinnostuneet partnerit yhdessä keskustelemaan meidän kanssa siitä, että mitä tämä pitäisi olla. So first of all, we want to invite all potential partners to come to discuss with us that what could this be? What are all the aspects we could have here? Because this is a start, but it's not ready.
Precis, och det har varit jätteroligt här att någon varit och knyckt i ärmen att hej, vi vill vara med. Och det är det jag tänker, som, precis som Suvi sa här, nu är det en sån här liksom, nu har vi visionerat, det börjar liksom serveras här och sitten mennään sanoista tekoihin, te jotka tunnette mut så niin, det ska vara action också. Ja, och det ska vi göra i det här. Så det här är en invit till det kommande samarbetet till att vi ska ha någonting riktigt, riktigt fint som kommer härifrån Österbotten. Ska du säga ännu något konkret riktigt? Mitä seuraavaksi tapahtuu? Tapahtuuko syksyllä jotain?
Tapahtuu. Syksyllä me tavataan sen meidän verkoston kanssa, eli kaikki, jotka nyt kiinnostu tästä, niin laittakaa viestiä. Syksyllä me otetaan ensimmäinen yhteistyökokous, ja sitten me myöskin poliittisesti käsitellään tätä asiaa syksyllä, eikö niin? Ne on ne konkreettiset stepit. Me mennään professuurien kanssa isosti eteenpäin. Meillä on tässä muutamia esimerkkejä tullut tänään jo siitä, mitä se tulee olemaan. Eli lähdetään työstämään. Me tarvitaan siihen teitä, me tarvitaan siihen alueen yrityksiä, me tarvitaan siihen valtiovaltaa saadaksemme se rahoituspohja riittävän hyväksi. Yritykset, yhteisöt, säätiöt, valtiovalta ja me, yliopistot, yhdessä me pystytään rakentamaan tämä. Eli se on se seuraava steppi. Meillä tulee syksyllä jo muutama professuuri varmasti auki, keväällä lisää niitä. Sitten me kutsutaan uusia tohtoriopiskelijoita. Jos tuli semmoinen olo, tai jos se oma väitöskirjan raakile on vähän pölyttynyt pöytälaatikossa, niin nyt on aika puhaltaa pölyt pois sen päältä, ottaa Elinaan yhteyttä. Täällä useampi näkee, että tulee semmoinen, että no siellä se nyt on vähän aikaa pölyttynyt. Mutta nyt on oikea aika. Ottakaa Elinaan yhteyttä. Elina on ihan huippu. Me ollaan tällä viikolla ehditty jo tosi paljon innovoida sitä, että miten niitä tutkimusryhmiä me perustetaan. Mitenkäs sitten siitä tohtorin papereista edetään kohti dosenttuuria. Mitä tukea siinä tarvitaan, minkälaista tutkimusta siihen rakennetaan. Niin se on se yksi seuraavista stepeistä. Näiden professuurien ympärille me tullaan rakentamaan advisory board, vähintään meidän johtoryhmälle, ehkä myöskin sitten meidän poliitikoille, se on teidän poliitikkojen päätettävissä, mutta ainakin me johtoryhmässä ollaan siitä ihan superinnoissaan. Well, our Eureka network, we have taken the first steps to build EU funding applications. We continue that. And we continue with all the project applications. Jenny, there is Jenny. Jenny is doing those during night and days, hopefully more during daytime this autumn. No joo, sitten me halutaan varmaan sitä hyvinvointitieteiden identiteettiä lähteä rakentamaan. Niin kuin se, mistä mä aloitin, että tämä ei ole vain lääketiedettä, tämä ei ole vain terveydenhuoltoa, tämä ei ole vain sosiaalityötä, tämä ei ole vain pelastustoimea, vaan tämä on me kaikki yhdessä. tämä on sitä kokonaisturvallisuutta, tämä on sitä varautumista, valmiutta. Se ei ole vaan Pelan asia, vaan se on meidän kaikkien asia. Se, mitenkä ihmiset voi hyvin, ei ole vain lääketieteen, sosiaalityön tai terveydenhuollon asia, vaan se on myös Pelan asia. Nämä on meidän yhteisiä asioita ja tämän päälle me rakennetaan uusi hyvinvointitieteet.
Jag tycker det där var så bra avslut så jag behöver inte upprepa det. Och så kommer vi ihåg det där hela tiden. Varför gör vi det här? Det här gör vi ju för våra människor. För att de ska ha det så bra som möjligt här i vår region och i Finland och i hela världen så börjar det sprida sig sen dit. Men för vår del, tack, kiitos, thank you.
Okay. So, welcome to the Bion Defense. Are we really prepared? Seminar, which is actually the last seminar at the Vaasa Future Festival. But I think it is nearly the most important one. The one we had before here, just beforehand, I think was the also really important. It was about welfare and social services. And now it is part of the comprehensive security also. Today we are talking more about comprehensive security and preparedness. And we have very good panelists and keynote speakers here from Finland and Sweden. And we are very happy to have this Nordic dimension today. At first, I will present and give a word to our rector. If this works as it should. No, it doesn't go further. There is the program. Once I will, you know the program because you are here. What I say that we have the pause at 1:30, and then we are ending at 4 because there are some people who have to catch the train. So 15 minutes before. And now opening remarks, please, Hannu Vahtera, our President and CEO.
Thank you, Mala. Surprisingly small table. There we go. Distinguished guests, speakers and partners, ladies and gentlemen. It is my pleasure to welcome you all to this Beyond Defense afternoon hosted by our University of Applied Sciences. The title of today's event poses a direct and perhaps a bit uncomfortable question. Are we prepared? And in my opinion, the answer is simply not yes, nor no. Preparedness is not a permanent state that could ever be achieved once and for all. Rather, it is a continuous capacity to recognize changes that require attention, anticipate the consequences, and then act accordingly to maintain ability to function when the way to operate and the systems we normally rely on come under pressure. Preparedness is also about the capacity for all of us to act together, learn from experiences and adapt to circumstances that we may not fully even anticipate. Today, we are not seeking a single definitive answer for the question that was posed in the title of this afternoon. Instead, we will seek to understand whether we understand our dependencies and vulnerabilities. Do we know how to make use of our strengths, and have we planned and practiced working together for the moment when the resilience is truly tested? One thing is for sure, that our security landscape has fundamentally changed in the recent years. Russia's ongoing war of aggression against Ukraine, the many crises in the Middle East, hybrid and cyber threats, and threats targeting, for example, critical infrastructure, have made security a tangible part of both economic policy, education policy, but also energy sector and technology development. Strategic competition between major powers has also intensified. China's global role is still growing. The transatlantic relationships are not the same we grew accustomed to. And technological and economic dependencies, as well as access to critical resources, are increasingly being used as instruments for political influence. These developments inevitably affect the security and geopolitical position of Europe, as well as the Nordics, Finland, and the wider Arctic region. And these developments also have an impact on our security of supply and preparedness requirements. Within the European Union, security, competitiveness, and technological capability are becoming increasingly interconnected. Although the key decisions in foreign and security policy are the responsibility of each member state, the European Commission is playing a growing role through defense industrial policy, single market regulation, funding, and research and innovation policies. This can be seen, for example, in the proposed omnibus measures intended to facilitate, for example, defense investments and production just recently, as well as the Commission's proposal for the EU's multi-annual financial framework for the coming years starting from 2028. Competitiveness, security, and defense are all featured much more prominently there than before. One could say that the three have become an integral part of Europe's industrial and economic renewal. This transformation, however, is not only a threat, it also creates opportunities. There is a growing international demand for Nordic expertise and innovation. And three current examples that I, as an example, selected here. Could somebody help to change the slide, please? There we go. Thank you. So the examples that I would like to shortly mention here are three Finnish-based companies, ISAI, Sensor Fusion, and Doppelganger, where, for example, ISAI is a growth company that provides intelligence-based radar satellite technology and operates an extensive constellation of satellites as we speak. In a recent funding arrangement that was as recent as this summer, I believe this company was valued at more than 10 billion euros. So we are talking about huge values. Sensor Fusion, in turn, develops solutions for detecting and countering drones, and Doppelganger is a spin-off from Technical Research Center of Finland and develops decoy systems based on printed electronics and three-dimensional structures that protect people and critical equipment. And I think all of these three examples are very timely, but also worth mentioning due to the fact that they operate in different fields of technology, but together demonstrate something essential about the potential of Finnish expertise, and also show that when we harness our engineering skills to develop cutting-edge solutions, we can come up with something that serves multiple purposes, ranging from commercial to military use cases, and that also increase our national defense sovereignty and capabilities. Creating innovations and startups is, however, not enough. We, in addition, need concrete decisions, growth capital, skilled people, testing and experimentation environments, and international networks. We must ensure that the promising companies are not only established in Finland, but are also able to scale, internationalize, and retain their critical expertise here in the long run. Finland is firmly integrated into the European community of values and the Western security architecture, but our geography has not changed. From a logistical perspective, Finland in many sense is an island, and great majority of our foreign trade is transported by sea, and production across several industrial sectors depend on the continuous flow of materials, components, and energy. A serious disruption to maritime connections in the Baltic would quickly affect businesses and society, and the same applies to electricity, communications networks, payment systems, and other digital infrastructure. We in Finland have built an efficient network and highly specialized society, and while that of course is a strength, the continuity of operations at the same time rests on very many interdependencies. And while dependencies bring efficiency, they also enable local disruptions to spread rapidly across the entire system, and therefore it is crucial that we understand not only the risks that this situation causes to our own operations, our own organizations, but also to the wider system actors and interfaces on which our ability to operate depend on. A dependency we do not recognize is a vulnerability. Preparedness should not be seen as a cost or as a set of mandatory plans that are once done and then put on the shelf to be taken from there once they are needed. Rather, effective preparedness strengthens companies' ability to anticipate change, manage supply chains, protect information, and continue operating during disruptions. It also strengthens the confidence of customers, employers, investors, and partners, and as such, resilience is also a source of competitiveness. The title of today's event refers to a new Nordic reality. The security, logistics, energy systems, communications, networks and expertise of Finland and, for example, Sweden form a shared operating environment. The membership of both countries, first in the EU and recently in NATO, has opened opportunities to a wider Nordic cooperation and on the expectations placed upon it. It is quite naturally in our interest to build upon these Nordic countries' long-standing good relations, but also to learn continuously from one another. In Finnish model of comprehensive security, the vital functions of a society are represented as a diamond, and this diamond illustrates the interdependencies between its various sides of the diamond. At the center of the diamond, however, is the individual. And the individual is not the bystander, but the active participant who has a role in the total comprehensive security and preparedness. Functioning of society is not safeguarded by any one authority alone or by some distant institution, but requires public administration, businesses, higher education institutions, civil society organizations, communities, and everyone sitting here today. That does not mean that everyone should be expected to cope alone, but it means that when prepared, resilience brings precisely that the fact that nobody should have to be and act alone. The themes of this year's Vaasa Future Festival are very topical, and New Nordic, defense, energy, artificial intelligence, and education are all connected to one another and to this broader picture. The role of higher education institutions is to educate skilled professionals, conduct applied research, provide development, testing, and experimentation environments, and to connect companies with national and international networks. At Vaasa University of Applied Sciences, we are also pursuing this mission through the Ostrobothnia Dual-Use Defense and Security Hub that has as its purpose to bring together the regional companies, startups, research organizations, and industry to work together to turn their expertise into practical solutions that we can use for the benefit of our area. The role of a University of Applied Sciences is to turn knowledge into competence, competence into solutions, and solutions into stronger regional resilience. With the majority of our students being the ones who establish their lives here in the region, more than 50% in Vaasa, more than 2/3 in the kind of a larger municipality area, I believe we are also in a very natural position to do so. I would like to conclude by highlighting 4 short perspectives. First, resilience is an operational capability built through practice. And while plans are essential, readiness exists only when we can recognize change, make decisions, communicate effectively, and act together. Preparedness must be exercised before it is needed or it is too late. Second, a dependency we do not recognize is a vulnerability, and we do need to identify the critical systems, networks, and partners on which our operations depend. Thirdly, resilience is a source of competitiveness, and reliability, continuity, and adaptability are strategic strengths for companies, regions, and nations. And here, higher education institutions have a huge role in supporting this. And lastly, technology provides support, but trust carries us through. So even people lack the competencies, capacity, or confidence to act, or if they do not trust one another or the institutions of society. I would like to conclude with these remarks and wish you all a wonderful afternoon here, and thank you for being here. Thank you.
Thank you, Hannu. And now we go to the next speaker, keynote speaker. This is not so easy. It should be. Peter, mitenkä tämä ei oikein vaihdu? Otatko Mikan kuvan? Yes. Mika Hyytiäinen Mika's military career actually began in the late Cold War year, 1985, including combat engineering studies, C4ISR planning, and leading military technical research culminating in a military professorship in a Finnish military art. Comprehensive security and its flip side, hybrid warfare, has been on his agenda since 2000, long before the terms became established. At present, Mika works besides military innovation on strengthening security in agriculture, the circular economy, and energy. Please come on stage, Mika, and I also want to thank once again. We have been cooperating a long time. Also, you have been very active in Vaasa, creating our comprehensive security cluster from 2011, I suppose.
Yeah.
Stage is yours.
Thank you. I also tried to put the first slide. It's there. So it's nice to be back here. I think that I was in the first Future seminar also speaking when it was not. Actually, this building was already up building, but not yet ready. I have 3 points which are there in the slide, but I will start with a book, and then I will end up with a question, and we will have a panel discussion in the last. So actually, I'm going to give the key questions for the panelists also in my presentation. That book, which is there, it's not like estimating something that in an academic way. Actually, I was an author of that book, but I invented a lot of guys to write an article in that. And those guys, for example, were Pekka Toveri, who is now EU Parliament member. He left the Defense Forces as a general in Intel. Mikko Heiskanen, who just retired in the also general, making C2 systems, but also as a wider logistics. Vesa Valtonen, who is now still in the service, but he has been actually, when Petter is starting to his presentation, he was also the chair of the committee. And then a guy from Estonia, Leo Kunnas, who is also a parliament member at the moment, but he was a chief of operations in the Estonian Defense Forces, and he actually wrote what happened when the Estonia went to NATO. And the whole book in there is actually a discussion between those guys when they were young and now when they are a bit older. So all of those guys were in the process of estimating what's going to happen. So it's actually the next war that Finland is going to fight. That was the idea, because those guys, me included, we were actually planning what the defense forces would look like in about 2020. And then in the 2017, I gathered those guys and we asked ourselves where we write. We also all wrote something about the future, but most of the things we did actually under the curtains, which were not public. And actually, we were right. And I think that's a good feeling. But if I would have gathered those guys in 2013, we would have been wrong. Because everybody was asking, why are you still here? You're professional military guys. Why are you still building up the defense forces that all of the other European countries almost didn't do at that moment? In 2014, if I would gather those guys, the answer would be maybe, but nobody knows, because the Crimean situation and what happened in the Donbass, it wasn't that kind of high alert. In 2022, 5 years after this book, I can say that we were right. And what the Defense Forces was doing is actually what the Defense Forces has been doing all the time for 500 years or something like that. We were anticipating that Russia is coming back, and Russia came back. In the beginning of the 2000, they were, I would say, almost all-time lowest. Maybe they were so low in the 15th century before the Ivan and the guys who actually went to Russia. But Putin has just started. And we just estimated that Russia is not going to change. So we were preparing for that Russia when it comes back. And now it's back. So how about estimating what's going to happen? I would say that this seminar, all the other guys are talking more like what's going to happen. I will talk a bit about how I remember that path in this time. I have a bit complicated slide, but I will walk you through that. And I will start first in the right-hand corner with the word war. When I went to the conscript service, it was 1982. So you can see that with the color of my beard. At that time, there were 630,000 guys in the Finnish Defense Forces. We were preparing that when the attack from the Soviet Union comes, we will start fighting as a conscripts from the garrisons, so that they already came through the borderline. Finland was divided in areas where all of the areas were independent. They were kind of small armies, so that even though that Helsinki goes down, you can still fight in the northern part of Finland or eastern part of Finland. So every general in those days who were leading those areas, they had their own rights to start the war, even if the president is gone, even if anything has gone. And we had a huge guerrilla doctrine in Finland. All of the conscripts, whatever your branch were trained for the guerrilla warfare. And that's not so long ago that we had that kind of system. I would then highlight the fourth generation, because that is actually one of the things that in Finland is very, it's a tight way when you try to go from the peace to the war in a very short notice of time. But I also would like to highlight the word there, losses and sacrifices. Because if you are thinking about risk management, if you are going to the war, you know that you are going to lose a lot of guys. Ukraine has lost about maybe 230,000 guys already in the graveyards. Russia about twice that much or something like that. Nobody actually knows, and there are a lot of things that we are discussing at the moment. Finland lost almost 100,000 guys in the Second World War, and then the population was 3.5 million. So the risk management is actually not saving lives, but getting the best price of the lives that you are doing. Then when you go to the preparedness side, preparedness, the next topic in there, to me, the preparedness means that everybody in the Finland will be restricted to do something. It's not something that happens in the aerial side. It's not an accident or something like that. It's the issue that you are permitted to, for example, take fuel for 20 liters per week, and that considers everybody. Everybody who's living here. You have to do something with your water or things like that. The preparedness is not something as an attitude, it's actually a plan what is critical in the society. And the resilience for me is actually the best word put in there, but the limitation is also in there. In the defense forces, we got an arousement, kind of a wake-up call in the 08. So in the Georgia, when the Georgia war came, and that was actually something that the preparedness in the defense forces were then already giving the higher up. The other authorities, mostly in the Finland, they are talking mostly like risk management. There's still something happens, someone dies. There may be even someone goes to the legal issues, so that's a damage, and you have to live with that. But it's not that big thing. And what happened in the let's say in the beginning of the 2000 in Finland, and which is still actually the approach to the security and resilience, is actually continuity management. And for me, that idea behind that words is actually coming back to what we have already today. It's just a nuisance. And that's why I put in the topic, the crisis severity. What we are preparing to. At the moment, the Finnish people are preparing to nuisances. They are hoping the continuity management. But actually, on the other side of that where the war is on the other side, I put word normal. But normal at the moment is not peace. It's already something else than peace. There are hybrid actions. There are economic warfare is ongoing. We also have our share of that. So actually, there's not a peace at the moment. There's something else. It's something that we are now accustomed to. And what has changed that already today is that what is there, the hybrid warfare. I started to investigate that word about 2015 in the United States, where we were making the crisis management. And it was called comprehensive security, or not comprehensive security, but comprehensive approach. That was something that we were using, we Western countries were using in NATO and in the US, in Afghanistan, in Iraq, and places like that. And when the Crimean situation happened, the US general said that this is evil version of comprehensive approach. It is actually using our societies and our weaknesses against us. And that is one of the biggest things that I have maybe learned in my whole military career. Well, this is very complicated slide. Petteri is going to use the word intertwined or multi-horizon preparedness, but all of those things happen at the same time. Akseli is actually using the word renewal, and that is one of the biggest things that I have now in my mind, which is all the bottom in there. How the resilience can be bouncing forward. Can the resilience be something like that we are learning from the crisis? We are not coming back. We are a lot better than we used to be. And when I see Ukraine at the moment, I'm not that much looking about the drones and things like that. I'm thinking, for example, that kind of things, that what has happened in the Ukraine in circular economy, in food production, in agriculture, in building, in energy consumption. Ukraine is not the same as they were when the war began. And they are going to be more modern in all cases. They will be very European after the war, because the war has kind of changed them. My next slide is actually an old one. But this is one thing that is always been in my mind. It's a cooperation. US General told me in 2004, maybe, or 5, that every time when they write the word joint with a big J in there, it means all the other authorities also. It doesn't just mean the military branches. Now the military is talking about multi-domain operations, but I would say that economy is also a domain. Information is also a domain. Diplomacy is a domain. So you can actually have a lot of domains. And what is lacking at the moment, I would say still, even in Finland, is the cooperation, the structures for the cooperations. The picture is from the National Security Plan from 2011. It actually has that kind of swim lanes. What are the crises and problems that all the authorities are handling? But the silos are very far. They are very strict because you have to have a legislation what the police can do and what they can't do, what the fire brigades can do, what the military can do. So actually you can't do the other guy's business. But there are 3 types of differences that I want to share you. The first one is that the small bubble between the 2 silos. It's an agreement of some problem that needs to be cared by 2 authorities. And that's probably happening all the time. The next one, the small block, there, in my mind, it's like police, customs, border guard cooperation, which has lasted from the 1920s. So that the border guard guy can actually act like a police. And he can act like a customs guy, because there are not so many guys in there, so he can do the professions of all of them. All the maritime authorities, which is very, very highly developed in Finland, maybe the best in the whole world. But what they have a concept. They have a written concept how to do that. The border guard guy knows he's not kind of just making it into a situation. He already knows what he has to do when he's doing, for example, the police business. And we don't have those that much in Finland, even in Finland. We may be one of the best in the whole world, but we are still not so good. And being best and being good is a different thing. But one thing we have, and that is technology, because this is a technology country, and we believe in technology. The network which goes all the way through all the authorities, like Tuve or Virve or the other kind of communication devices where we store our stuff, that is something that makes that common. And it's a kind of technology push. That's an opportunity, a big opportunity also to change your business. Because if you already have the cooperation platform, you can actually start to cooperate. If you want to cooperate, but you don't have a platform, that will be a big problem. So I would say that that is one of the big things in here. In panel, we will discuss about business. And what is actually wondering me all the time, or what I'm wondering is that why can't we make business out of this? Because even though we are not good, we are best, or maybe the best. So why can't we sell that what we already know? And why can't we make that as a business here in Finland? I think I have to point in that direction. This is my 3rd point, and this is actually about the people. And this is what the guidance we are giving to the people. And I hope that we will see also those older ones in Sweden, because the one which is highest up in the left is actually the Swedish doctrine for the if the war comes. But it's convenient because you can upload it also in Finnish. You can upload it in the meän kieli, the old dialect of Finnish, which is in the high north in the Sweden. You can upload it in the Arabic also, and English, and of course Swedish. But they published that in 2018. And it was a big thing. But when you see that Sweden did have that all the way through the Cold War, and Sweden had that in all of those phone books where you had the phone numbers, the last part of that was actually that book in the Cold War times. So it just tells me that it comes back. The 72 hours in there, it's the Finnish concept, what the normal people need to do. But what I would like to highlight is the one which is in the middle. It's a Lithuanian one, and I don't know if you have ever seen that. Lithuania made that book in 2014 as a NATO country. You could upload, I don't think if it's easy to find. I didn't find it in the internet when I tried to do that for my presentation, but there's about 76 pages or something like that as a cartoons, which is also in English. And if you look those cartoons, the first one is actually that 72 hours, what you have to have in your home. But then when I was talking about how depth you think, how severe the crisis will be, the last picture in that book is what you take when you have to be a refugee and you leave your home. What you have to consider and how you cope with that kind of situation. And I will share one hint of that. If you have to go with your family, put the water in small bottles. The first thing is that if you have only one big water bottle and it gets broken, the all water is lost, but that's a technical thing. Actually, what they guide there in the book is that when your family gets separated, you can share the water so that you can give it also to your children, so that they will have the water bottle when they are separated from the parents. And I'm sharing this because this is actually how deep the Lithuanians went already in the 2014. And why I'm highlighting this is actually that are we actually talking to our people that the several things might happen? That the security is not a service that you can kind of upload and wait and think that somebody else is going to do that on your behalf. So actually the bottom-up thing is maybe one of the most important things that you have to take into the consideration. And Paula and Minna and David will tell quite a lot about that in their presentations. And then, if you're talking about that, what was the highest point in that diamond that Petter is going to also to show us, it's a mental thing. It's actually something how we think about the crisis and kind of we handle them in the mental way. And I have been starting to think about the X generation, so the people who have born in the 1990s. They are now about 30, 35. Maybe some of there are quite a few here also in the room. You have born in the world, or in the Finland, actually not in the world, because if you are born in the Somalia, you haven't have anything like but war. But in Finland, when you are born in Finland or Sweden or Norway, there's never been severe situations. The severe situations are unemployment or something like that. You have been learned to be personal, not collective, like my generation. And now you have to change everything if the bad happens. And I really think that is one of the big things at the moment here in Finland. Actually, the mental strength, and that we are communicating about the bigger crisis and the possibility that they will come in the right way. This is my last point. I ask if all the multiple paths that we have created in the last 30 years are going to the same goal. And of course, for me, the goal has always been a war. And now the war is kind of back. But I have seen a lot of things done in the plans which actually are not going to that direction. They are actually harming the path towards the war, if the war is the next thing that is going to happen. One of those things is, for example, opening those storages for the National Supply Center too early. Because you can open them only when you have already made those restrictions. Those storages is not for the normal things that you don't have to change your life. They are protecting us in the very severe crisis, and they are connected to the critical infrastructure. And that is actually one of the things that I think that we have to tell our people. And we have to tell that also to our politicians. That even though that it would be nice to kind of give something for the people who are hurt, but you have to see what is coming next. And if the hybrid war comes, as the data has anticipated that straight after the Ukraine crisis is solved, and it will not be solved like we like that to be solved. And I don't think that it's going to take so many months now when they have to sit down and put some kind of peace agreement there. The hybrid actions will rise. And NATO is now talking about that the war is coming back in 2030. If it happens, I would say that it will happen if we are not prepared. If we are prepared, we can actually hinder that. But preparedness is actually something that we have to do all the time. This was actually my presentation. I would say that I didn't leave any time for the questions because we will have the questions when we are having the panel. So you have to stay up to that and then ask your own questions to the panelists also. I thank you.
Thank you, Mika. And here's a little present for you.
Thank you.
Hope it's tasty.
Yeah, I have to give my... Petteri already have your own.
Okay, Petteri, you are the next one, but you can wait a little bit. Oh.
I have to go and undress.
Petteri Korvala started as the Secretary General of the Security Committee on September 1st, 2023. His current position focuses on issues related to the comprehensive security of the Finnish society, which he promotes with the Secretariat of the Security Committee he leads. Korvala's previous work history is Defense Administration, where he was 30 years. He has 30 years of experience in various domestic and foreign positions, both in defense forces and in the Ministry of Defense. Korvala has served, among other things, as a deputy military representative at the permanent representation of Finland to the EU, a chief governance development in the Defense Command, and a liaison officer in the United States European Command, and as a military assistant to the permanent secretary in the Ministry of Defense. So warmly welcome, Petteri Korvala.
Thank you very much. Just checking first that you are able to hear me. Oh, great. Wrong direction. Distinguished guests, ladies and gentlemen, good afternoon. First, I would like to thank organizers for the invitation and all you attendees for your interest in preparedness. It is a privilege to give a keynote speech in this part of the seminar here in Wasa at a festival that is not only interested in the future, but also how we shape it. The guiding question us today is direct. Are we really prepared? We have plans, reserves, capable authorities, resilient companies, and citizens with a strong will to contribute. The real question is whether these strengths form a functioning whole when several systems are under pressure, disruption lasts longer than expected, and reliable information is contested. My key message today is this. Preparedness is now a core condition for sovereignty, competitiveness, democratic confidence, and our everyday life. I will use two central slides to carry the substance of my argument. 5 forces changing the security environment, followed by 5 strategic shifts in preparedness. Preparedness extends much beyond national defense, which is absolutely essential, but it depends on a functioning society. Energy, transport, communications, health services, industry, logistics, public trust, and other key elements of society. The Nordic perspective is especially valuable. Finland and Sweden belong to the same alliance. Our economies, infra and supply chains are closely connected. Our institutions, businesses, civil society, and trust among population are strengths, but they must be maintained, exercised, and renewed all the time. Let us now turn to my first content slide. Its main message is that today's risks are increasingly interconnected, unpredictable, and capable of rapidly crossing different borders and sectors. I will use these 5 drivers to explain why. Starting from the international order and its fragmentation, Russia's full-scale invasion of Ukraine ended any remaining illusion that a large-scale war had become impossible in Europe. It also demonstrated how quickly assumptions about warning times, escalation, and duration of conflict can fail. Modern warfare reaches deep into society, as we have witnessed to energy systems, telecommunications, ports, hospitals, industrial capacity, and population resilience all affect the cause of today's conflicts. Recent developments in the Middle East have made uncertainty itself a strategic factor. Changes between military escalation, diplomatic signals, and renewed threat can occur within days or even hours, while the intentions and thresholds of the actors remain difficult to assess. Disruption around the Gulf has shown how quickly alternative futures can open and close. Shipping may reroute, insurance costs may rise, energy and fertilizer flows may contract, and market expectations may change several times before our political decision makers have a stable awareness of the situation. A distant crisis can therefore reach a domestic factory or household through delayed components, higher prices, energy market volatility, and interrupted access to raw materials. Closer to home, damage to Baltic Sea subsea infrastructure, navigation disturbances caused by GPS jamming, and the instrumentalization of migration demonstrate how pressure can be applied before the threshold of armed conflict to create uncertainty, test procedures, and narrow political freedom of action. Finland and Sweden have deepened cooperation through NATO bilateral preparedness activities and for example, work on cross-border infrastructure, like railways. External and internal security can no longer be planned in isolation. The first point on this slide therefore changes the frame for everything that follows. Fragmentation does not only increase threats, it reduces predictability. Geographical distance no longer provides reliable protection, and legal distinctions between peace, disruption, and crisis do not always match operational reality. Preparedness must work even when we cannot assign a reliable probability, timetable, or endpoint to the crisis in front of us. My second point is related to technology and security and their connection. The global CrowdStrike disruption in July 24 was not a hostile cyber attack. It was a faulty software update which disrupted airlines, health services, banks, and public services across continents. The lesson was uncomfortable. The societal effect of a technical failure can resemble the effect of deliberate action. Hostile actors can exploit the same dependency. Artificial intelligence makes phishing more convincing, vulnerability discovery faster, and influence operation easier to scale up. A synthetic audio or video message can imitate a trusted leader during the first confusing minutes of disturbances or crises. Even when corrected quickly, it can shape citizens' behavior before verified information is available. Finland offers a concrete example of both vulnerability and capability. Our society, as very well known, is highly digital, but we also have a strong cooperation between authorities, telecommunications operators, financial institutions, and cybersecurity ecosystem. Backup arrangements for critical payments and growing attention to secure cloud, data and communication services show what preparedness by design means in practice. The second point on the slide is therefore double-edged. Technology expands our capabilities, but it also connects and concentrates vulnerabilities. Europe learned the economic power politics intensifying through its dependence on Russian pipeline gas. The rapid reduction of that dependence after 2022 required new suppliers, infra, hard decisions, and private investments. In Finland, the LNG terminal solution at Inkoo and accelerated energy diversification showed that strategic adaptation can happen quickly when the objective is clear and shared. The same question now applies to semiconductors, pharmaceuticals, batteries, critical minerals, satellite services, and cloud infrastructure. A supply chain may appear diversified while several suppliers depend on the same factory, software environment, or, for example, maritime route. For Finland, security of supply has never meant isolation or complete self-sufficiency. It means ensuring that openness does not become paralysis. The National Emergency Supply Organization and a close public-private cooperation provide a strong base. But they must increasingly take into consideration Nordic and European flows, because medicines, food, data, energy, and transport cross borders every day. The third point reminds us that economic openness and economic resilience must be built together. Resilience is not protectionism. It is a capacity to continue essential production and services when normal commercial channels are disrupted. Turning then to my fourth point related to environmental crisis. Europe has met disruptive floods, prolonged heat waves, and major wildfires also in the near past. For example, in 2024, floods in Valencia, Spain, showed how extreme weather events can overwhelm transport, communications, and emergency response, while also generating an intense public debate about warnings, responsibilities, and trust. Of course, Finland's environmental risk profile is slightly different, but not separate. Storms can endanger the functioning of electricity and mobile networks. Heavy rains can overwhelm urban drainage. Changing snow and ice conditions affect roads, railways, forestry and agriculture. Extreme weather can also increase simultaneous demand for rescue services, healthcare, and need for support from local authorities. A relevant Finnish lesson comes from the long-term work to improve the resilience of electricity disruption after severe storms. Underground cabling, vegetation management, and statutory continuity requirements are expensive, of course, but they reduce the societal consequences of future disruptive events. This is adaptation as security policy. The fourth point is not separate from traditional security. Environmental disruption tests infrastructure, public services, and equality at the same time. A power cut may be inconvenient for many, but dangerous for a person dependent on home care or electrically powered equipment. My fifth point is related to social cohesion. Across Europe, hostile information activity seeks to exploit existing divisions rather than invent entirely new ones. During elections, conflicts, pandemics, energy crises, misleading narratives target confidence in authorities, science, media, and democratic processes. Finland remains a high-trust society, but we are not immune. Loneliness, exclusion, unequal access to services, youth, distress, and fragmented media environments can weaken people's sense of belonging. At the same time, the experience of recent crises has shown the strength of Finnish society. Voluntary organizations, conscripts, local communities, companies, and ordinary citizens have repeatedly mobilized to support continuity and those in need. Sweden's renewed public preparedness communication, including the booklet already highlighted here by Mika, in case of crisis or war, and Finland's 72-hour preparedness recommendation for our households, both recognize that citizens are not merely objects of protection. They are actors in security. The fifth point in the human is the human foundation beneath the other four. Social cohesion does not mean uniformity. Democracy needs, of course, disagreement and includes it. Resilience requires enough shared trust, credible information, and mutual responsibility to act together despite disagreement. These five drivers I just highlighted are not separate lanes, but increasingly interconnected. The new reality is not simply more new threats. It is more interaction between already existing ones. That interaction is why we now move from diagnosis to response. Ladies and gentlemen, my second key message to you is that preparedness must evolve from separate activities into permanent, adaptive, and society-wide capability building. The 5 shifts listed on the slide describe how. The first shift is much more ambitious than risk reduction only. Preparedness should not begin only when vulnerability becomes visible. Strategic foresight should also identify emerging technologies, new partnerships, skills and investments that can strengthen society before disturbances or crises test them. The question is not only how to absorb a shock, but how to build a society that is more capable, competitive, and cohesive because it's prepared early enough. Europe's energy response after 2022 illustrates the difference. The immediate task was to secure supply. The larger opportunity was to diversify energy, improve interconnections, accelerate cleaner domestic production, and create new industrial capabilities. Investments in renewable electricity storage grids and clean technologies can strengthen security of supply and future competitiveness at the same time. But this requires an opportunity lens in foresight and investment. Decisions on digital infrastructure, energy education, research and regional development should be assessed not only for the risk they mitigate, but also for the options they create. The strongest investments serve several purposes. They reduce dependence, expand national room for maneuver, support innovation, and reinforce public confidence. A resilient society does not merely bounce back or learn after a crisis. It anticipates, invests, and moves forward before the crisis arrives. My second point related to shifts is focused on systemic resilience. A hospital can have a continuity plan and still fail if fuel, water, telecommunications, medicines, or staff transport are unavailable. A telecommunications operator can have backup power, but the backup depends on fuel, logistics, and access to sites. Every plan contains assumptions about another actor. Finland's public-private preparedness pools and regional exercises are valuable precisely because they bring dependencies into a same room. The new legislation on the resilience of critical entities also strengthens the identification and supervision of functions that society cannot afford to lose. Internationally, NATO's 7 baseline requirements for resilience connect continuity of government, essential services and civilian support to military operations. Finland and Sweden are also developing practical cooperation on civilian protection, cross-border evacuation and transport systems. These are systemic questions because Northern Europe must function as an operational and economic space, not as disconnected national compartments. This is the logic of the second shift on the slide. The basic unit of preparedness can no longer be a single organization. It must be the service chain, the region, and increasingly the cross-border system. Third point is related to time. Preparedness must manage several clocks at once. The first clock measures minutes, hours, and days. Cyber attacks, storms, sabotage, and military escalation. The second measures months and years. Sustained economic pressure, shortages, and prolonged hybrid influence. The third measures decades. Demographic change, climate adaptation, infrastructure renewal, and technological developments. In Finland, aging of population and shortages of skilled labor are long-term trends. During a health emergency, prolonged power failure or mobilization, they become immediate operational constraints. Likewise, deferred maintenance may remain invisible for years until a storm or hostile act exposes it in one night. The third shift asks decision makers to see several clocks on the same dashboard. Urgent decisions must not sacrifice future resilience, and long-term programs must survive changes in attention and political cycles. The objective is not perfect prediction. It is to preserve options and make robust decisions under continuous uncertainty. Turning then to the individuals. Capable authorities and legitimate national leadership remain essential, but resilience cannot be delivered to society as a finished public service. The first hours of disruption often challenge especially households, workplaces, local communities. Can people manage without normal electricity, communications or payments? Finland's 72 hours concept translates preparedness into practical household action. Voluntary defense and rescue training, first aid organizations, village networks and local associations build skills and relationships before a crisis. The European Union Preparedness Union strategy now encourages a minimum of 72 hours of population self-sufficiency and calls for preparedness education, stronger warning systems, and public-private partnership. This is a significant European shift toward a whole-of-society culture. The fourth shift is therefore not a choice between top-down and bottom-up. The strongest model connects authority from the top, knowledge from the ground, and trust in both directions. My final point focuses on continuous capability building. This fifth shift appears last on the slide because it enables all the others. Preparedness is not just a campaign that is completed when the report is published. Plans age, personnel change, contracts expire. Finland's updated security strategy for society, adopted as a government resolution January 25, strengthens not only preparedness but also capacity to respond to disruptions and crises. It emphasizes the role of individuals and links national work more closely with the European Union and NATO. Importantly, implementation is to be followed through regular reporting. That is the logic of continuous capability, not a one-off project. Continuous capability building means stable funding for foresight, exercises, stockpiles, knowledge development, maintenance, and so on. It means measuring how long essential services can function, how quickly leadership can be activated, and whether lessons identified in exercises and real-life operations are actually implemented. Taken together, this slide describes progression. Learn and renew, connect systems, manage time, mobilize the whole of society, and sustain capability every day. Distinguished audience, let me return to the question of this seminar. are we really prepared? The honest answer cannot be a simple yes or no. Preparedness cannot be just a certificate that a country receives. It is a relationship between the risks we face and the capabilities we maintain. Because the risks are changing, preparedness must remain unfinished. The Nordic countries have capable institutions, advanced societies, competitive companies, active organizations, and comparatively high trust among the population. But strength can become assumptions. Trust can be lost, infrastructure can age, expertise can disappear. A plan can remain impressive on paper while the people, contracts, and systems needed to execute it have changed. The good news is that Finland and Sweden do not need to invent an entirely new model. Our national concepts for comprehensive security and total defense provide a strong starting point for every strategic shift I have described today. These solutions connect authorities, business community, organizations, and citizens. They link external and internal security. They focus on the vital functions of society and recognize their interdependency. They place the individual at the center, not at the margin. If we place my two content slides side by side, Finland and Sweden's resilience concepts work as a bridge between them. They translate interconnected and unpredictable drivers into permanent, adaptive, and society-wide capability. Crisis resilience is therefore not only one topic among others in today's program. It is an operating logic connecting national defense, security of supply, critical infrastructure, digital security, household preparedness, and community resilience. But the concepts must be made real again every day. The strategic changes outlined today require long-term work. They require sustained and predictable resources. They require trained people, exercises, reserves, maintenance, secure technology, and strong public-private partnerships. They also require a societal climate that values security without becoming fearful, that values responsibility without weakening solidarity, and that protects open democratic debate while resisting manipulation. No government term can complete this work. No authority can deliver it alone. No company, organization, household, or institution can opt out without weakening the whole. Comprehensive security concerns us all. So are we really prepared? We are prepared when we recognize our dependencies before they fail. We are prepared when we can act before certainty arrives. We are prepared when we protect the vulnerable, maintain trust, and learn while under pressure. And we are prepared when capability building continues after public attention moves elsewhere. This is the new reality of preparedness as I see it. And that is a promise and the responsibility of comprehensive security. Comprehensive security concerns us all. Thank you very much.
Kiitos. Thank you very much, Petteri Korvala. And we are continue with the questions with Mika's panel. And please, you can take your seat.
Thank you.
Thank you. And then we continue to Akseli Koskela, who is one of the Finland's foremost voices on resilience. I turn also the next slide. Yes, this time it works. He serves as the Director of Foresight and Preparedness at Technology Industries of Finland, leading the organization's Foresight team, covering cyber, mining, defense and data center industries, and acting as Secretary of the Resilience Forum. With over 2 decades shaping Finnish and European policy, Koskela has worked at the sharp and end of crisis management and comprehensive security across 4 continents, Europe, Asia, Africa and Latin America, including a direct role in Finland's NATO accession negotiations. He has built trade policy networks across the EMEA region and led corporate delegations at UN climate conferences. Please.
Yes, good afternoon, everybody. Let's see how this works. So I speak on behalf of 5,000 companies that are based in Finland, everything from defense to mining to space. And via our network, we can reach million companies in Europe. So I can tell that resilience, comprehensive security, and all the topics that I will mention soon are pretty much on the agenda of the companies at the moment. Turning resilience into competitive, we talk about different shocks and different scenarios, and these are maybe the ones that we have been talking most during the last 12 months. Trump has given us quite a bit of a trade war effect or impact at the moment. It's not only the tariffs, it's all kinds of restrictions that come on a weekly basis. 2 days ago, we were talking about power supplies and their restrictions to the US because of security. So security is part of the trade. Then we have the Strait of Hormuz that has also been mentioned. It's not only about logistics or oil price, it's also affecting now air freights in Bangladesh, and it also affects on insurance payments. It's so disruptive and so asymmetric that it's hard to even tell how these affect. And of course, the Baltic and the Arctic, 95% of our export go via Baltic Sea. It's also in tons and euros the same. And I have few slides about the critical raw materials, strongly dominated by few markets in the world. We started our resilience work a year and 6 months ago. And basically we started from theory of resilience that is mainly known for psychological background, as you might know. And what is it in practice? So we start before the shock happens. There is the foresight and preparedness that has been mentioned. From the industrial point of view, foresight is interesting when we look 3 months to 6 months ahead or 6 months to 3 years ahead. We are not really interested in what happens tomorrow. There's other actors and agencies that work on the very daily crisis. We are interested in the strategic expansion of time, and this is how we are working on it. Shock absorption is when the shock happens. We need to act without paralyzing when the shock happens. That is what we are trying to practice. That follows adaptation when the changes in the operating models should take place and the very daily action should be taken into consideration. When the recovery starts, there's also change there. We should fix the things that are not broken. And finally, the renewal. We need to take a leap to a bit higher level that we were in before the shock. That's the idea of resilience. We need to take a step higher, and we need to prepare for the next shock and the next and the next. In practice, what we are doing in Foresight, we started just about 6 months ago a project called ResAI, a Foresight project, AI-tooled. We are training our people now, about 40 people, to understand what foresight is. very basic capabilities of foresight, classic foresight work. And we are, after that, going to take this into Finnish industries. We are going company by company talking about foresight. It's very operative work. Then shock tolerance. We are making a toolkit for this tolerance. This is a part that we work together with National Emergency Supply Agency, HVK, and its pools that are partly also in our organization. We have 5 pools at the moment working on this. Then the adaptation part. Last spring, we decided to work some sort of a manual for companies. And we actually collected 30 companies in the same table discussing resilience, its different semantics, what does it really mean and how does it work? And we came up with 1,000 different measures, action points that any company or organization can look at how to prepare for crisis. And I want to highlight that when we talk about resilience management, it's a bit different than risk management. In risk management, you probably know what the risk is or you have scenarios, but we don't actually care about those scenarios because anything can happen and we need to look from inside how we are prepared and prepare for the worst. It can be anything, so we start from inside. At the moment, these 1,000 action points are being tested with different companies. Again, walking to the offices of companies, meeting the personnel, meeting the CEO, different people of the company, seeing which one of these 1,000 measures could actually work. And we're going to scale this up. European Commission is already looking at this manual and trying to make this a European level practice. Then the recovery part. We are trying to build more and more public-private partnership. I will come back to that later. And then the renewal, that's about innovations and new skills. You might know Veturi program by Business Finland if you work with innovation policies. We are doing this in a new step as well, trying to make it a more scalable and more private-led program for renewal in security. I will give you one concrete example how resilience is turning into competitive edge for Finnish companies. You might remember when we talked about the mineral treaty that Trump proposed to Ukraine in weaponization of Ukraine as a kind of a other part of the coin. And we were thinking, what is this all? And same time or a bit after that, and still we're talking about Greenland and it's about its minerals. This is something we have been following, state of play, what happens in the mineral sector, because it's very crucial. We know that many minerals are very concentrated in the global market. The most rare earth materials that we need, they are the most concentrated as well. You can see China there very strongly, but even Brazil with niobium is the top leader of producer in the world. We have something in Finland as well, but the figures are a bit smaller. And why is this important? Well, also the refinery. When you have the mineral and you start preparing some machinery components out of it, that's also very China-oriented in the global market. Finland has something there in cobalt, something with lithium and so forth, but we need to see how to create this a bit more, more shared. And it's important because we need all these materials in the other end. We need them in defense, we need them in e-mobility and digitalization, we need them in the renewables. So what did we do? We started a new project called Fennoscandian Industrial Resilience Alliance, and this is Nordic. Finnish GTK together with us started to look what are we actually producing in minerals and how do we process them. But not only what we are doing, we're looking what Sweden and Norway are doing. And now we're trying to make this general understanding of each process and each production and see how we could help each other. If you have oil refinery and we have aluminium, what can we do together? And this is all with the security thinking in the head. So we are going to the practice now. We're looking for partners with this. We are looking for companies, and we're also trying to expand this to Iceland and Denmark. Most likely, this is still preliminary thinking, and this is mainly GTK oriented, but industries, us, are also involved. And the last point I want to mention is this public-private partnership. As I mentioned, it's a big part of the resilience that we try to understand what it is. And we created this forum that is a bit different than others. We bring all the Finnish ministries, all the critical companies together twice a year to discuss how to make this happen, that resilience becomes actual projects like FIRA that I just mentioned. And it has been a success. It's only invite-only type of a forum, but the project have been really scaled, and we are trying to launch even new projects. So this is my open invitation. If you have anything that resonates in this presentation, you would like to collaborate with businesses, contact us. We are really open for collaboration, be it Nordic or Finnish purely, or even Nordic Baltic. So this is basically what we do about resilience at the moment. Thank you.
Thank you, Akseli. It was very good comment. And now we are turning to the coffee. I think it's nice to have a coffee break in between. And we wanted to have it so that you have time to discuss, and we hope really now you have time to network with our guests also, because they have to hurry up then after 4. So you don't have so much time to discuss. So please take all the possibilities now and discuss with them. All right, coffee pause is over, and I'm sorry that we didn't get what I ordered, but you get something at least. So hopefully you get some good cookies or something. But anyway, we are continuing now to the next session of our seminarium, and we are now having a Swedish perspective. And Minna Lundgren is the first one. And Minna is a senior lecturer in sociology and a researcher at the Risk and Crisis Research Center at Mid-Sweden University in Östersund, Sweden. Her research focuses on total defense and public preparedness, risk and crisis communication and disinformation. We are very happy that we have recent year actually very close connections to your university. I have a lot of cooperation really ongoing right now, and we are continuing heavily. So please, Minna, come to the stage.
Can you hear me? Okay, good. So the situation that I'm drawing on a little bit today, or the situation that sparked my interest a bit in this question, dates back to 1956. What happened in 1956? Yeah, things happened in Hungary, and Sweden was on alert. Something unusual took place in my mom's family. It was different from many other families because both her mother and her father were conscripted. They had wartime placement. So should the situation deteriorate, my grandfather would need to leave home and serve elsewhere. My grandmother would need to leave and serve elsewhere. My mother's brother would go away with his school. But there was no plans for children who didn't go to school yet, because most of those children in Sweden, they stayed at home, usually with their moms. And this was part of the total defense planning that Sweden made up after the Second World War. And when we now have resumed total defense planning, we're using the same system. And today I want to discuss a basic difficulty in preparedness. We're trying to anticipate an uncertain future, but many of the instruments that we are using they were designed for a society that no longer exists. So my main focus is Sweden, although some of my argument is relevant across the Nordics. And I mean, Finland and Norway in particular have total defense systems and welfare societies with several similarities to the Swedish systems. Even though the precise institutions may differ, but the underlying dilemma is shared. How can we use lessons from history without allowing historical assumptions to limit our view of the future? And this matters because preparedness is never only about formal structures, legal mandates, or organizational charts. It's also about people. It's about who is expected to be present for work, who looks after children, who supports an older relative, and who can serve at another location on short notice. If our arrangement rely on outdated picture of employment and family life, they may look robust on paper while proving much less workable in practice. And this presentation is based on a book chapter that I wrote together with Professor Ann-Sophie de Wander for a publication funded by the Nordic Welfare Center and the Nordic Council of Ministers, and you can download it. Oh, using that QR code. Yeah, so I'll wait if someone wants to do that download. It's both in English and in Swedish, and I can send the link also later if someone missed it. Anyway, so let's begin with the problem that preparedness is meant to address. During heightened alert or armed conflict, the Nordic countries would face serious challenges in maintaining health and social services. And such circumstances would also affect not only people who need assistance, but also the organizations providing it and the employees responsible for keeping it running. Demand is likely to increase because we know that armed conflict produces injuries that require immediate treatment, rehabilitation, and long-term support. Displacement places additional pressure on receiving municipalities and local services. And experiences from Ukraine also demonstrate that children, older adults, people with disabilities, and those living in difficult socioeconomic circumstances can face heightened risks when ordinary support systems are disrupted. And at the same time, the capacity to respond may decline. Hospitals, primary care, home-based care assistance, and residential facilities could all face staff shortages, damaged infrastructure, transport problems, and disrupted supply chains. Family members who currently provide a substantial amount of unpaid work may have to work longer hours, serve elsewhere, or relocate. And if relatives can no longer provide support, either people will need to go without it, or professional services will have to absorb this additional workload. Geography also matters, because across the Nordic region, access to services differ between urban, rural, and remote communities. Many sparsely populated municipalities have a relatively large, older population, long travel distances, and a limited workforce. And those conditions are already challenging, and they become much more serious when fuel, transport, or staffing is constrained. NATO membership also adds another dimension, even if fighting doesn't take place on Nordic territory, because member states may be asked to support, for example, patient evacuation or receive a rapid influx of casualties. This is a difficult word for me. Casualties following a mass casualty event. So we therefore have to consider two developments at once. The need for healthcare and other assistance is likely to rise, while the people and organizations expected to meet that need may have fewer resources available. Healthcare services for old people and support for persons with disabilities are central to the Nordic welfare model, and their continuity is both a humanitarian responsibility and also a condition for the rest of society to function. And Sweden resumed total defense planning in 2015 following, well, the deterioration of the European security situation. And authorities responsible for essential societal functions must now prepare to continue their operation during heightened alert and war. And the success of that work, it depends on more than assigning duties, because it requires an honest assessment on who will perform them and what other responsibilities these people carry. Maybe you're all already experts in Swedish total defense terminology, but I'm going to just talk very briefly about and clarify some key concepts in the Swedish system. The first one is total defense duty, totalförsvarsplikt, which applies to Swedish citizens and permanent residents from the age of 16 until 70. It has three components: military service, civil service, and general service duty. General service duty means allmän tjänsteplikt. Military service and civil service concern designated individuals, whereas general service duty is broader. It's something that the government can activate during heightened alert or war. And if the government activates general service duty, a person may be required to remain in their ordinary employment, or they can also be assigned other work that is necessary for essential societal functions. So under general service duty, an employee may be obliged to continue working, and they are no longer free to resign from their positions. You cannot change workplace if you want to. And the last concept is wartime placement or wartime posting, krigsplacering. And this identifies where a particular person is expected to serve. And this placement may follow from military or civil service obligation, but it may also form part of an employer's preparedness arrangements. An individual could consequently be assigned to the armed forces, to a civil defense function, or even to regular workplace. And this system is intended to give organizations greater certainty about staffing. It helps prevent the same person from being claimed by more than one organization. You cannot have a wartime posting within the military organization and at your ordinary workplace. That's not possible. But it mainly answers one question: where should this individual be or work during heightened alert or war? It does not answer the equally important questions surrounding that person. Does that employee have young children? Is there another parent around? Is their partner also assigned to serve elsewhere? Are they supporting perhaps elderly family members or a family member with a disability? Because formal allocation is not the same thing as practical availability. And this distinction lies at heart of this presentation. A register over people with wartime placements can allocate an employee to an organization, but it cannot by itself make that person's wider obligations in life disappear. And to understand the problem, we need to look a little bit briefly at the assumptions that were built into the original model. During the Second World War, women partly replaced conscripted men in paid employment in Sweden, elsewhere also. But in the early 1950s, economic growth made it possible for many households to live on one income. Married women were often discouraged from working. Public childcare was limited, and women's earnings were treated as a supplement to the male breadwinner's wage. And the post-war system of wartime placement was shaped by that social order. Men could be called away to serve elsewhere because someone, which was usually a wife, was presumed to remain at home and take responsibility for children and the household and dependent relatives. And unpaid caregiving was effectively a very invisible resource within defense arrangements. Contemporary Nordic societies, they look very different. Employment is now the norm for both women and men, and this is supported by preschools, schools, and publicly financed welfare services. If we go back to 2024, employment among people aged 20 to 64 was high across the Nordic region. In Finland, for example, it was 66% among women and 77.3% among men. In Sweden, 79.9% for women and 83.9% for men. So this is an important achievement. Women's participation in paid work has strengthened equality, economic independence, household security, and it has also contributed substantially to Nordic prosperity. But it means that the former reserve of unpaid labor is largely gone. And today, the same person may be essential in two places at once, as, for example, a nurse, as a teacher, as an engineer, as a social worker in the formal economy, and also as the person who organizes most of the support at home. Preschools and schools make this combination possible in everyday life. But these institutions may themselves operate with reduced capacity during a severe disruption. So the issue here is not whether women should work. That's not in question. The issue is whether preparedness arrangement has fully adjusted to the social transformation that made equal labor force participation possible. When the state expects everyone to contribute more in an emergency, we must ask who will perform the unpaid work that still has to be done. The organization of welfare services has also changed. Activities that were once delivered almost entirely by public bodies are now provided by a mixture of municipalities, regions, private companies, and other organizations. And Swedish primary care centers illustrates this shift very well, because privately operated health centers accounted for about 26% of the total in 2007 and 47% in 2023. And the extent of outsourcing differs greatly between municipalities and regions, and we can also see comparable development across the Nordics. And this diversity, I wouldn't say that it's automatically a weakness, because different providers can contribute with expertise and capacity. The preparedness difficulty arises because responsibilities, resources, and incentives are not always aligned. Much of the relevant legislation was developed when nearly all health and social services were publicly operated. The duties of private providers during heightened alert or war can therefore be less explicit than those of public agencies or organizations. For example, some private providers, they operate in several countries or have even foreign owners. And in a wide-ranging emergency, they may need to balance competing demands across different countries. Other providers are small organizations with very limited financial reserves or no additional staff to call upon. Yet, the ultimate responsibility for residents doesn't appear when delivery is outsourced. If a privately run residential care facility closes during heightened alert, the municipality must still make arrangements so that its residents receive support. And the legal and moral obligation remains, even if this municipality, for example, no longer employs the staff who normally provide the service. And this creates a potential gap between responsibility and operational capacity. A municipality may be accountable for continuity without having a complete overview of personnel, available beds, subcontractors, or supply chains. And regional authorities can face a similar problem in healthcare. And this challenge becomes especially acute when needs change quickly. Internal displacement may bring many new residents to one area. A rural municipality may need to cover longer routes with fewer employees. A private provider may be unable to operate while the public body has no reserve workforce ready to step in. So preparedness must therefore extend beyond contracts that describe normal service delivery. Preparedness needs shared information, continuity requirements, clear expectations, and practical coordination across public and private actors. Otherwise, fragmentation in peacetime may become a serious loss of oversight when we are under pressure. But service provision is not the only thing that has become more fragmented. Employment itself is also organized in new ways. The gig economy is one example. Previous research from one of my colleagues showed that platform-based and highly flexible arrangements have also reached welfare work. Some workers have no permanent positions. They respond to requests on short notice and may sometimes combine shifts from several possible employers. Temporary employment is another factor. Around 15% of all jobs in Sweden are on temporary contracts. And the proportion is actually likely to be higher in parts of healthcare and social care. It is possible for an employer to assign temporary employees to a wartime posting, but that only lasts as long as that person has that temporary contract. So frequent turnover and short contracts make this it doesn't become reliable. And we can take an example of home care staff who may work for several providers. During heightened alert, they cannot be equally available to all of their employers. They're just one person. An hourly on-call worker may not be covered by general service duty between the shifts because they are regarded as employed only for the hours when they have agreed to work. An organization that relies heavily on such labor may therefore discover that its apparent staffing level is not the same as the workforce that they can actually mobilize. And this arrangement also affects employees' incentives and room for maneuver. So which employer should a person prioritize when several organizations request their labor? What happens if they are assigned work elsewhere by the public employment agency, which can actually happen? Or what happens if they already have a military wartime placement? A system that is built upon a stable relationship between one employer and one employee doesn't map neatly onto a labor market that is characterized by multiple contracts and rapid movement. And this makes it very difficult for municipalities in regions who are responsible for social care and healthcare to form a complete picture, because they must estimate a changing demand while also identifying who is qualified, who is present, and who is actually legally available to work. Providers may differ in their obligations, their capacity, and their willingness to also accept additional tasks. And meanwhile, we already have this problem today. Recruitment problems, they affect welfare services across the Nordics already today. So the central question is not simply how many names appear on a staffing list. Central question is whether those people can be reached, whether they have the necessary competence, whether another organization also depends on them, and whether their employment relationship allows them to be mobilized. Headcounts alone can create a false sense of security. And the structure of the workforce makes this discussion inseparable from gender. We know that Nordic labor markets remain highly segregated. Women are strongly represented in education, healthcare, and social services, the very sectors that must continue when society is under severe strain. In Sweden, 87% of licensed nurses are women. And the most common profession in Sweden, you know what that is? Assistant nurse. We have approximately 130,000 assistant nurses in Sweden, and 89% of them are women, according to statistics from Sweden Statistics and National Board of Health and Welfare. And many of these employees also carry a larger share of childcare, household work, and support for relatives. Equality within families has certainly increased, but domestic responsibilities are still unevenly distributed. Healthcare jobs are also very difficult to combine with emergencies at home. For example, if my child's if their school teacher is calling me to say that my child is sick, I can easily go to school, pick up my child, and then continue my work at home. That's not possible if you're a nurse within clinical work, for example. And research from Umeå University has shown that flexibility matters for equality among couples with children. In occupations with very rigid working conditions, women are more likely to reduce their hours to reconcile employment with family life. In 2025, 34% of members of the Swedish Association of Health Professionals worked part-time, mainly because of workload and family commitments. Now, consider what happens during heightened alert. Clinical demands arises. Shifts may become longer because during heightened alert, a state of heightened alert, or in the event of war, an employer may increase working hours by 50% without prior consultation with the labor union. Schools and preschools may reduce their opening hours because they too lack employees. At precisely the moment when welfare organizations need, mainly women, to work more, those same employees may face greater demands at home. The COVID-19 pandemic offered a limited preview of this tension. Some preschools closed temporarily because of staff shortages, while children of people in designated essential occupations were prioritized for places that remained available. But what about an on-call assistant nurse who works shift for several employees and has no permanent position? If that parent is also a single parent, and he or she cannot be recognized as essential because they don't even have a contract. And they can't take on a daily job because the preschool is not open for them because they don't have an essential job. So this is like how preparedness and the current labor market as it looks, they don't go hand in hand. So the historical comparison is revealing. During the Second World War, mostly unmarried nurses were sent to serve away from home, partly because, well, married women were discouraged from paid employment. And today, many nurses and assistant nurses have children and other dependents. Long shifts or relocation may leave families without adequate support. And this is why functioning childcare, including provision outside standard office hours, is part of civil preparedness. It is not a peripheral family matter. It directly shapes whether essential personnel can report for duty and remain at work over time. And the same applies to unpaid assistance for older relatives or family members with disabilities. If that support collapses, public services will inherit additional demand. So individual and societal reserves are therefore closely connected. Ignoring one weakens the other. And finally, we have to say something about modern families. They should appear here. Oops. Now. Like this. Not only the labor market has changed, but so have also families and household arrangements. 2 years ago, 73% of Swedish children lived with both biological parents, and the remainder lived with one parent, sometimes together with a new adult. About half of the children whose parents lived apart alternated between the two, while many of the others lived mainly with their mother. And at least one child in 10 lived in blended families. And families, the concept of families also includes same-sex parents, single parents by choice, and adults who have children with more than one partner. And these are ordinary features of contemporary society, but they complicate assumptions about wartime availability. If one parent is ordered to serve elsewhere, the other may not be able to just simply take over. That second parent may live in another country, and they may also have an essential role of their own. They may also have a wartime placement. So a plan involving several households cannot be rearranged as easily as the traditional nuclear family model assumed. And urbanization and labor mobility add another difficulty. Many young families live far from grandparents and other relatives who might once have provided emergency help. Professional homogamy makes the problem even sharper. This term describes the tendency for people to form relationships with someone in the same occupation or sector. It is relatively common within the armed forces, within the police, and in medicine. 10 years ago, there is no more recent research, 25% of Swedish physicians were married to another physician, and 12% of the rest lived together with a nurse. And these couples are concentrated in occupations that become especially important during crisis. So imagine that one parent is assigned to a temporary field hospital and the other is also. Which role takes priority, and who cares for the children if both of them must serve away from home? So the system that we have with wartime placement registered, this is designed to prevent two organizations from claiming the same individual. But these registers do not provide an equivalent overview at household level about couples assigned to different locations or separate parents whose individual placement leave the same children without an available caregiver. Household circumstances are not private details with no bearing on national resilience. They determine whether a person can reach an assigned post, work long hours, and sustain that commitment. A staffing model that overlooks modern family life may significantly overestimate the personnel it can use. Yeah. So let me return to the initial question. How do we prepare for an uncertain future when some of our instruments reflect an outdated society? Swedish total defense system has actually never really been tested. The challenges that I have described, they are therefore partly hypothetical, but they are not speculative in the sense of being detached from reality. They arise from well-documented features of contemporary society, high employment, gender-segregated occupations, unequal, unpaid household work, fragmented provision, insecure contracts, diverse family forms, and uneven access to services across the country. There are also gaps in awareness. Many people do not know what general service duty would mean for them. Even someone who has been informed of a wartime placement may not fully understand its practical consequences. Employers face a highly mobile workforce and may be unaware of an employee's obligations to other organizations. So neither employers nor the Swedish Defense Conscription and Assessment Agency have a complete picture of households in which two adults may be assigned to different locations. So the danger is that unresolved conflicts are transferred to individual employees. I'm trying to think about my time here. So what I want to say is realistic preparedness therefore requires more than additional names on wartime placement lists. It calls for coordination between employers, clear duties for private providers, workable childcare, attention to household level conflicts, and planning that recognizes regional, generational differences. So the key question isn't simply how many people can we assign to a wartime posting? It is under what conditions can these people actually serve? Thank you.
Very good. I'll try to. Thank you, Minna, very much. And yes, Minna has Finnish roots, so that I asked already. So thank you very much. And we go over to the next. So Daniel Metcalf is the founder and CEO of Vival Corporation, a Swedish civil resilience startup developing the resilience hub, a connected household preparedness system. Before founding Vival, he spent 20 years advising governments on crisis infrastructure through clients including the FCO, Cabinet Office, UN and EU. He lives near Gothenburg and is an active voice on Nordic civil preparedness. The stage is yours, Daniel.
Thank you. Thank you. Okay, firstly, hello everyone. I hope you can hear me okay. All good? Fantastic. Thank you. There we go. Perfect. Well, wow. It's been a real privilege, hasn't it, to listen to the speakers and sessions that have happened already today. I've enjoyed them all, and actually all covering some very important and timely subjects. I'm delighted to be with you here in Vaasa and also to be in this wonderful innovation centre. It's quite a marvellous building, isn't it? My name is Daniel Metcalf and I'm the founder of Vival Corporation. Vival is a startup based in Gothenburg. We're building the Resilience Hub. It's a fully connected household system with also integrated technology. And inside it, you will find absolutely everything you would need to get through a crisis situation. There's everything that you would need for a full 7 days. A slightly different focus now, as I'm going to cover a piece which unfortunately often gets forgotten. And it shouldn't do, in fact, it really shouldn't. But I believe it's an essential piece of the puzzle to address if total defence is to be achieved. I'm here to talk about household preparedness, the first line of civil security. Okay, so why am I here? Well, I've had 20 years experience in advising governments on crisis technologies. And I've had the privilege to sit within the Foreign and Commonwealth Office in London, through crisis events, as well as many embassies globally. I've also lived for long periods of time in two countries that are, quite frankly, very unprepared, and that is Spain and the United Kingdom. And now I live in one that is very prepared, and that's Sweden. The part that I'm really interested in, and my real passion, and I'm heavily invested in, is the resilience of the normal household. And that's what I'm going to talk about today. Okay, so this first slide, really I just wanted to set the scene with 4 numbers. So the first number, 822 billion euros in weather and climate losses across the European Union between 1980 and 2024. This next one is the one that should really surprise us all, because a full quarter of that happened in just the last 4 years. Let me just repeat that. So a full 25% happened in 48 months. That's crazy. And the last 4 years hold the 5 costly events that have ever been recorded in Europe. And added to this, Europe is currently warming at roughly twice the global average. That's faster than almost anywhere else on Earth right now. This isn't just a bad decade, I believe it's a new baseline. And I have to mention the recent raging wildfires that we've all seen in Spain and France, resulting in over 300,000 people either displaced or evacuated. The out-of-control fires even reaching the very gates of 2 of Europe's largest cities, Bordeaux and Madrid. There were even plans being discussed, can you believe it, about the potential evacuation of the entire of Bordeaux. So that's roughly 1 million people. Just imagine the images of that actually happening. Yet, unfortunately, I think we have much more of this to come, and that this is just the beginning. On this slide, I've picked just 3 events that happened over a 3-year period. These are not projections either. These are things that actually happened. First off, Aya Valley in July 2021. Germany, Belgium, the Netherlands were all affected by severe flooding. This resulted, unfortunately, in around 200 lives lost, over 40 billion euros in losses, which is still the single costliest weather event in recent EU history. In fact, in some of these valleys, help physically could not reach people for many days, and this is in Europe. This is not a warning failure, but a reach failure. Next, and it's been mentioned by my colleague here before, Valencia. I'm sure we can all remember the terrible scenes on our televisions of that devastating flooding. It looked like an apocalypse had happened, didn't it? A year's worth of rain falling in just 8 hours. That's pretty unbelievable, isn't it? Yet it happened. It resulted in 224 people dead, 15,000 people displaced from their homes, and close to 1 million people affected across the wider region. The warnings in this case unfortunately arrived late, and for many, only after the water had already arrived. And the rains hit an entirely unprepared population. The next one really should be a biggest wake-up call for us all. The Iberian power blackout just in April last year. 55 million people affected across Spain and Portugal lost power. The lights just simply went out. Trains stopped mid-journey, phones died, and hospitals had to switch to generators. Supermarket shelves were completely emptied within a matter of hours. No war, no attack, no storm. The grid simply failed. Again, striking a wholly unprepared civilian society. And this all happened on a perfectly normal Monday afternoon. Okay. I'm going to bring it closer to home now, in Sweden specifically. And I've included this example to show that even one of the most prepared countries globally is not immune to failures. And that maturity means fixing failures publicly and not pretending it didn't happen. So the example I'm going to give was in February 2024 in Gothenburg. A fire broke out at Oceana, which was a new water park that was being constructed at the Liseberg theme park. A fire broke out and it quickly developed into a fire gas explosion within minutes. Sadly, one person was fatally injured. But next, authorities needed to warn nearby residents immediately that they should go indoors, seal their windows, and stay in place until they had further instructions. That particular warning went out by SMS, which was the traditional method at that time. But just at the moment the message was sent, the network was completely overwhelmed. This resulted in only 40,000 of the intended messages being received in time by the people that needed them. But actually, here's why I'm telling you this story in a room that already knows Sweden's systems very well. What actually matters is what happened next. Sweden didn't bury that failure, it fixed it right in public view. And now, today, SE Alert, a new cell broadcast system which requires no app and cannot be congested the way SMS can, is rolling out right now as I speak. So, this is exactly what a highly mature civil resilience system looks like, I believe. Knowing the problem, owning it publicly, and then fixing it. Bravo, Sweden. And to help and protect us through all of these situations that I've mentioned before and conflicts, we have our excellent militaries and first responders. The military, when the call comes, they go, they put absolutely everything on the line, including their own lives, so that ours can carry on as normal. That is the promise, and as far as I'm aware, it's never been broken. The emergency services, they arrive every single time, and they run towards what the rest of us are running from. All for people that they've never even met. And today, there's even now more pressure on them than ever before. We have significant increase of acts of terrorism, there's more civil unrest, and, of course, we have the constant threat of Russia. And Europe's largest ally no longer can be fully relied upon. In modern history, not once have they ever let citizens down. They serve the people every single day. There's a but, unfortunately. There's a but coming. So why does a well-trained, well-funded, courageous response still fail to reach everyone in time? Because there's simply not enough of them. And there never can be, can there? Not for 55 million people at once. Not when a year's worth of rain falls across an entire region within 8 hours. And not when 3 things are compounding at the very same time. More people, denser cities, more of us living in exposed places than at any other point in history. Bigger events, more frequent, more severe, sometimes hitting several countries on the very same day, just as Storm Boris did, if you remember, that hit 7 countries in one day. And now, new threats, hybrid attacks, grid failure, cable sabotage, disinformation, frequently arriving with absolutely no warning at all. This isn't failure of will, is it? It's a rule of arithmetic. Too many people, too many threats, too many climate events, too few people to respond. So, if the arithmetic doesn't work, someone else must hold the line, mustn't they, in the first few hours or days? And that someone is the ordinary household. Because in the first hours of any serious event, the household is actually on its own, not through being abandoned, but because responders are busy saving people who genuinely need it. Every single household that can hold out for 3 days is a household that frees a responder to reach someone who can't. I believe being prepared is no longer a personal or a lifestyle choice. It is the civil duty of each and every one of us. It's also the biggest force multiplier that any nation has. However, none of this works without trust. The ingredient, I believe, which makes civil involvement work isn't willingness or money. It is the trust between the citizen and the state. And this is why countries like Sweden and Finland have an asset that most of Europe envy. The Organization for Economic Cooperation and Development asks some questions to its member countries, and I'm going to share a few of those with you. So the first question they asked was this: if there was a large-scale emergency, how likely is it that government institutions would be ready to protect people's lives? In Sweden, 61% said it was very likely, so that's obviously a very good score. The average is 53%, and the UK was down at just 47%. They also asked, what is your trust in your national government? And this tells a similar story. Finland around 47%, the average was 39%. But just look at this, the poor UK here, alarmingly down at just 27% trust in your national government. I find that shocking. And in the UK, only 1 in 5 people believe the political system even lets them have a voice. Can you believe that? Which actually is one of the strongest drivers of trust also. I also personally believe that having 7 different prime ministers in under 10 years doesn't help with trust either. But here's why all of this matters for everything I've said so far. A government can print 5 million booklets. If people don't believe the institution that sent them, then guess what? Nothing happens. Preparedness guidance is an instruction from the state to the citizen, and it only works where that trust relationship is fully intact. So let's take a quick look, shall we, at what unprepared looks like. And actually, all of us in this room have already seen what it looks like and seen what civil behaviour under stress looks like. And I'm using a shared, recent, universally recognised experience. And of course, that experience is COVID. March 2020. Shelves emptied across Europe within days, and unfortunately, Sweden and Finland were no exception. This was not a moral failure at all. It's exactly what an unprepared population does when shock arrives. They panic. Each individual decision seemed quite rational on that day, but the collective outcome certainly was not. And unfortunately, the people that lose that race to the supermarket shelves are the ones that can least afford to run it. The elderly, the disabled, anyone without a car, or anyone who simply couldn't take the morning off work to join a queue. Whereas, let's compare this to a household with a week's worth of supplies at home. They don't even need to get involved or join that rush, do they? It stays at home and leaves the shelf for whoever needs it most. And more importantly, they have the peace of mind and confidence to navigate themselves through that entire situation. Being ready in advance is not scaremongering. It's taking control, it's being responsible, and makes a difference in how a household experiences the crisis. So, what is missing? In the Nordics right now, the policy exists, the culture exists, but a single product for the normal household does not. Every Nordic government tells households to prepare. Sweden has distributed some 4.8 million booklets to everyone's door, and Finland has held this line for absolutely generations. The policy is not the problem. The problem is that we ask people to act and then identify nothing to act with. What exists today is survivalist gear built for the wilderness, not for a home in Vaasa or Gothenburg. I believe nobody wants army surplus sat in their hallway gathering dust and getting in the way. So mostly, many ordinary people do nothing, and guess what? The guidance quietly fails. Also, there's the institutional gap, which mirrors the product and funding gap. In Sweden, for example, Vinnova, which is the innovation fund in Sweden, names preparedness and civil defence as a funding priority. That's excellent. But very few countries in Europe have an equivalent. Also, the venture capitalists are much the same. Most funding is for military hardware, drones, and defensive and attack capability for war. They miss the defence of the citizen part. At Vival, this is the exact problem that we're building for. The Resilience Hub is a desirable object for the home, which can be enjoyed on the day-to-day, and then, when needed, dual use into helping citizens navigate crisis confidently, with peace of mind and complete calmness. Finland and Sweden already have what the rest of Europe are scrambling to build. They have the policy, the culture, and a population that will actually listen when asked to act. The policy framework is already written. Most of Europe is years and years behind. The culture, conscription, sirens, exercises, booklets, a population that expects to play its part. The product is the missing piece, the last mile between guidance and a household that is genuinely ready. I believe whoever succeeds at delivering this will not just protect their own citizens, they will write the playbook for the rest of Europe. As a closing thought, I'd like to leave you with this. The military and first responders have always done their part, haven't they? The real question is whether we, the citizens, are willing to do ours. Finally, I believe that it's no longer acceptable to stand like a question mark during a crisis situation, waiting for someone else to do all the heavy lifting. It is our civil duty to one another, as a minimum, to one, be prepared, and two, have a basic plan. Thank you so much for your kind attention. I hope you enjoyed the session. Oh, sorry. I have a gift. Thank you so much.
Yes.
That's very kind. Thanks.
Yes, thank you, Daniel.
Thank you.
And as you maybe heard, that he is not originally from Sweden.
I'm not.
He is British, but...
I'm a Brit, but living in Sweden, yes.
You love Sweden, that we heard yesterday.
Yep.
Yeah. And now I have a really honor to present our next speaker. Paula Risikko is a member of parliament and the first deputy speaker of the Parliament of Finland. She has previously served as the Speaker of Parliament and the second deputy speaker, and she has held 4 different ministerial portfolios in 5 different governments. Minister of Health and Social Services, and Social Affairs and Health, Minister of Transport and Local Government, and Minister of Interior. Paula Risikko is also the chair of the Council of the Wellbeing Services of County of South Ostrobothnia and the chair of Women's Preparedness Association. And she's also holding a Doctor of Science degree in Health Sciences. And I'm very thankful, Paula, that you find time to be here with us. Please, stage is yours. About the food, this in the between. So now there are some food. So before the panel starts, so we have some time when they go and settle down, this gentleman. So who are quick, so can have some food with you here, but don't eat there. And then afterwards, of course, there are some who have time to be here. Thank you for the what is it? I don't know, to Anne and Timo Suomalainen for this one.
Okay, thank you. Okay, thank you, Malla. Oh, yes, it's mine. Okay, ladies and gentlemen, my name is Paula Risikko, the first Deputy Speaker of the Parliament of Finland, and I have been Member of Parliament since 2003. During my political career, as Malla just told, I have served as a Speaker of Parliament and in 4 different ministerial positions, among other. I am the chair of the Council of the Wellbeing Services County of South Ostrobothnia and the chair of the City Council of Seinäjoki. I have also worked and continue to work for various non-governmental organizations, among others the Women's National Emergency Preparedness Association, where I serve as a chair. I am also the chair of the Finnish National Rescue Association Council, and I'm proud to have the opportunity to talk to you all today. My theme today is citizens' perspective, comprehensive security as a shared effort, the roles of government, civil society and citizens, and especially citizens. A few words about changes in the security environment. Finland is one of the safest countries in the world, but it is something that we must work on every day. At the moment, Finland is not facing a military threat, but I believe we must be prepared for everything. It is fact that the security situation has changed irreversibly due to our geopolitical position as Russia's neighbor, the conflicts in Europe and the unstable international situation. Changes in the security environment are driven by factors such as Russia's war of aggression against Ukraine, the situation in the Middle East, great power competition, hybrid influence activities, cyber threats, climate change, biological threats such as viruses and bacteria, the rise of gangs and gangs-related crime, instrumentalized migration, population concentration in urban areas and growth centers, technological disruptions, international organized crime, societal polarization, poverty and lack of prospects among parts of population, and so on. In addition, each of us will face different kinds of disruptions and emergencies during our lifetime, and we need to be prepared and able to act when they occur. Ladies and gentlemen, in the Finnish collaboration model for comprehensive security, the vital functions of society are taken care of in collaboration between the authorities, business communities, third sector organizations and citizens, as well as throughout international cooperation. The comprehensive security strategy for society emphasizes the role of individuals as key actors in comprehensive security. The comprehensive security strategy for society also describes the comprehensive security model in which the vital functions of society are safeguarded. According to the National Security Committee, the vital functions that need to be taken care of collaboratively are leadership, international EU activities, defense capability, internal security, the economy, infrastructure and security of supply, the functional capacity of the population and services, and psychological resilience. Safety and security management and information flow are recently been improved. The European Parliament and the European Commission are developing the European Union's internal defence and security. And Finland is member of NATO, which requires Finland to take a number of actions. We have recently invested in our defence capability, including increased funding, internal security has also been strengthened. For example, the number of police officers and border guard personnel has been increased. The government has made decisions that will improve the sustainability of public finance, and infrastructure has been improved, including the condition of roads and transport infrastructure. While the vital functions outlined by the Security Committee are all important, the security of both society as a whole and the individual is based on functional capacity and psychological resilience of individuals. Functional capacity means the physical, psychological and social capacity of the individual to cope with essential everyday functions. The functional capacity, independent survival and well-being of the population is ensured throughout high-quality education and maintain essential services, among other things. Inclusion and social capital are important factors contributing to the individual's coping. Because of this, it is important for different people to be able to feel that they are a valuable part of society and their local community. Psychological resilience refers to the ability of individuals, communities and society to withstand the stress caused by crisis situations and to recover from their impacts. The foundation for psychological resilience is created in normal conditions, and it plays a key role in the maintenance of functional capacity during crisis situations. And some words about voluntary national defence. In Finland, according to researchers that the individuals will to defend our country in generally high. For example, the most recent survey by the Advisory Board for Defence Information shows that 4 out of 5 respondents would be willing to participate in national defence according to their own abilities and skills. Finland is generally very strong in third sector across all fields. We are, so to say, a country of third sector organizations. In the field of voluntary national defence, the relationship is particularly strong as legislation supports these activities, and it has also been strengthened. And now I will tell you something about Women's National Emergency Preparedness Association, which is one third sector organization in the field of voluntary national defence. The role of my and our organization is to operate as one part of comprehensive security training and voluntary national defence. The mission of the Women's Preparedness Association is specifically to strengthen comprehensive security in our country. Our aim is to develop and strengthen women's capacity for safety and preparedness, and to increase women's opportunities to act for the benefit of society in emergency conditions. One task is to implement training that is open to all women. The Women's Preparedness Association is an organization for organizations. We do not have individual members. However, anyone can participate in our activities and training, so there is no need to belong to any organization. Our participants are ordinary women with different backgrounds. And you can see our members. We are really national umbrella organization, and we gather together 10 member organizations who operate in the field of comprehensive security. The main challenge nowadays is resources. Russia's war of aggression against Ukraine has increased interest in our activities, and the demand for training has grown enormously. There are constantly more applicants to our courses than we can able to accept. And here you will see organization structure. We have regional actors, very many regional actors in Finland, and many areas. For example, here we have Vaasa's area. And this is our organization. And funding, we get money from state, and also we have some foundations who help us, and of course we have Minister of Defense who give us money. But as I said, we have not enough money nowadays because we are so favorite organization. But then our mission is to ensure that women's skills and resources are fully utilized in society, and to train women for everyday safety and security situation, and provide women with the skills and preparedness needed to act during disruptions, crisis, and exceptional circumstances. And near-term goals. We have one key objective to establish a register of safety-trained volunteers. The register would provide a clear overall picture of the number of skills of those who have been trained, enable organizations to allocate their training resources more efficiently, support more goal-oriented training paths for volunteering, help municipalities to planning their preparedness, and to assist authorities in resourcing emergency conditions. And fortunately, the register is processing. It is currently included in Prime Minister Petteri Orpo's government program. And we just now, we do for this register very much work. And also we have another goals. Comprehensive security skills should be taught at every level of education, we hope so. And training should be recognized and credited in workplaces and educational studies. These are our aims. And activities. preparedness and security training. We have two big exercises, Nasta and Pikku Nasta exercises organized across Finland, and also webinars and individual courses. We make very much cooperation, international cooperation, and also in Finland we cooperate ministers with ministers and very many experts and so on. And of course we do statements and policy recommendations and so on. These are the activities what we do. And then same expertise and advocacy work. And then I will show what is the Nasta and Pikku Nasta exercises. You can read what kind of exercises we have. And then training program courses selection. This is our courses in our exercises. And very famous course is for example cyber threats and also psychological crisis resilience also, and psychological support course is very favorite nowadays, and also safety on the water, of course, and also operating in storm conditions and so on. And hybrid threats are also very favorite courses. And some pictures from our courses and exercises. And in autumn, this autumn we have four exercises. Pikku Nasta Vahtera have been in August 2 weeks ago, yes. And also Nasta Leijona and Pikku Nasta Poiju and Nasta Tikka in Ivalo. Welcome all women, welcome to these exercises. And the oriented in all exercises we discuss these vital functions of society, and we discuss a lot of all comprehensive security themes. And as we said, safety and preparedness skills belong to everyone. And then, ladies and gentlemen, in conclusion, the factors and threats affecting our security are becoming increasingly diverse and complex. There is no return to the old normal. The security environment in Finland has changed permanently. And one more. Finland's security strategy for society and collaboration model for comprehensive security are depend on the functional capacity and psychological resilience of citizens. Preparedness is always worthwhile. Education and safety skills increase not only your own security, but also the security of others and of society as a whole. Thank you. Oh, thank you. Thank you.
Thank you, Paula. Because you have to leave soon, so I want to ask one thing about that register. Because we were talking together there about that. So what about GDPR now? Is it a problem with that one, the register still, or what do you think when we get it into use? Because I think all in this room find it's very useful for us when it is really in place and we can use it.
I have waited the register so long that I can't say when we get it, but we do very much work for that register nowadays, and I hope that next year we have something to tell.
Yeah.
Yes, I hope so.
Thank you. And then I also want to mention that Paula Risikko has been a godmother of a long time ago. We had it's important project called Care Code. And we decided then with Paula also a long time ago that we do it again. And now we got financing with our Swedish partners, with the Mid-Sweden University. And I hope that you are our godmother again.
Okay.
Because
that's
you know
okay.
the project.
Yes, okay.
Yes.
That's okay.
We are helping children there.
Okay, thank you.
Yeah. Thank you very much. Now we are turning to the panel. And now if somebody's very hungry, you can very quickly go there and take some, I don't know what they bring, but you can go there and come back very quickly because we are continuing in 5 minutes. 5 minutes. And Ilari please come take food and come to sit. If you don't take food now, take later. But we are continuing now, and I will present now our panelists. So if you are there, many of you still there in the row and so on. Still some. So please come a little bit nearer then and sit. Anne is there standing. So please come here and sit. And then I present those who you haven't heard about anything about yet. So we have here Mr. Ilari Hatakka. Please, Ilari. And he is the director responsible for the Virve network at Suomen Erillisverkot Oy, a state-owned company, providing critical communications and digital security services for Finnish authorities and security operators. And he leads the development and delivery of mission-critical communication services that support public safety, security, and societal resilience. He's closely involved in the evaluation of Virve services as Finland transitions towards next-generation broadband critical communication solutions. And he was Ilari. And then we have the next one. Wait a minute. We have Tomi Kankainen here. And Tomi Kankainen is the Chief Innovation Officer at XD Solutions, specializing in innovation, technology development, and strategic partnership in the defense and security domain. He's actively involved in the digital defense ecosystem, DDE, fostering collaboration between industry research institutions and public stakeholders to accelerate the development and deployment of future defense capabilities. And I'm very happy to say that Tomi is part of our RDA advisory board from Vaasa University of Applied Sciences, and we are also member of the DDE, so we have going to have closer and closer cooperation. And then we have Markus Asikainen. Where is Markus? There. And Markus is the Director of Defense and Security Business Area at COFOR. Prior to this current position, he has worked in cyber and information security for over 20 years, both in IT companies and public sector. And he has been involved in the development of Finnish multi-authority operations at the Emergency Response Agency, the Police Administration, and the Ministry of Interior. Markus has a strong knowledge of regulatory framework that drives high preparedness, comprehensive security, and other security requirements in both public authorities and corporate business operations. Happy to have you all here, and the others you know. Please, Mika.
Okay, thank you. We have heard a lot of expectations. We have heard about quite a few problems. Now we are focusing in the last half an hour about the solutions. We are not going to make it technical, so we are not talking about the technical issues as such, but we are talking about who is the customer and what can we actually do. And how I see the panelist here is that Ilari is actually the guy who is running what we have now. And he is actually the guy who kind of gives the services for the government officials, but maybe also for the citizens in the future. Markus here is actually the maker of the solutions. So they develop, they do the things to help people to do what they are expected to do, all the officials and all that kind of things. And then Tomi is actually the guy who should actually grab some innovative issues, push us forward, but also give some import so that we can export the things that we create here in Finland. So they actually kind of are critical parts of the business in a way, which is now here in the crisis. And then, of course, you heard Daniel, who is already making a product for the families. who is trying to do that in a business way also. So he's just not interested in the crisis. He wants to solve them in the family level. And then Minna, I think that you are a problem owner, because you kind of showed us that the people who, or actually the guys who are part of the what the solution that we need in the crisis, but they don't know where they go, what they should do, and there are a lot of compromises in between. So this is actually the question about the communication in a way. But I will start first about what the crisis is. And I will give first to our techies 2 minutes about the reflection, what you have here today, and what are the pinpoints or the highlights that you would give us first before I will send up the first question. So maybe we start with Ilari. What have you grabbed here today?
Good afternoon, everybody, and thank you for inviting me to this panel. I have here 3 points following the president's example. In Finland, we have always lack of resources. We know that we don't have too much money. We have quite few people in Finland, but that might be learned us to cooperation, share resources, and we rather trying to build everything together than separately and independently. We have long tradition cooperation. You mentioned this maritime cooperation, METO cooperation, where maritime safety and security authorities share their surveillance systems and information and situational awareness. You mentioned Virve mobile authorities mobile network, what we are operating, also fixed security network, which we are operating in Finland. All these are examples where Finnish authorities can share information and share resources, because we don't have them for everyone doing them by themselves. The key thing is that the more you give, the more you get also in a cooperation. But there is a risk also. When we now prioritizing more and more this preparedness and put more effort, for example, to security and safety innovations and building more capabilities, it might also put a new way where organizations or nations who have resources, more resources than others, then might tempted to got it alone, do them by themselves and make silos and build separate capabilities that reduce interoperability and cause bad situation awareness, because they cannot share that after that. And when we discuss about innovations, historically many innovations in military were first developed for military purposes, like internet, GPS, radar, radio. These all are innovations built first for military, and then we have seen a lot of civilian solutions also in that sector. But today we are increasingly seeing this direction where innovations go reverse. We have many civilian innovations and technologies like 5G, AI, drones even, which are heavily developed in civilian purposes, civilian use first, but then they are coming rapidly, very important resources and capabilities for military use also. So for innovations, don't try to do military or defense innovations. Try to do innovations at all, and in some cases, that might become also very important military innovation and defense innovation. Civilian technology companies and research organizations and technology labs and so on, they are all important for military defense and security sectors also. We don't know what we knew, what kind of situations we face in the military and defense sector also in the future. And in the end, preparedness is a whole of society effort. Even the best technological innovations are not enough in critical situations on their own. Technology can provide capabilities, but resilience depends on people, organizations, and institutions working together. We need trusted public sector, trusted authorities who can cooperate efficiently and also in times during disruption. We need companies that can continue providing essential services even under difficult circumstances, and in fact, we need active civil society with citizens who are informed, engaged, and willing to contribute for the whole total security and safety and preparedness. These elements reinforce each other's, and preparedness is therefore not something that we can build by one organization or one sector alone. Preparedness is something what we build together. And these three things, I think, are here in every panel, in every presentation today heard in way or another. Thank you.
How about you, Markus?
Hello all. Today's presentation gave lots of thoughts. I would summarize that for myself, I see that we are facing kind of a convergence, meaning that in every presentation we can hear that civil sector and authorities are still in those own silos in a way. And from my perspective, as a person from a digitalization company, it's quite obvious that we don't see those barriers or kind of silos in digital world, or we shouldn't see those. Meaning that we should kind of concentrate also how to create this digital backbone for all this that we have discussed today. Because we have learned from Ukraine that the more than society works as a normal society, even though there is a wartime in some part of the countries, the more resilient the country is actually. So we should put lots of more effort also to understand the correlations, how, for example, so-called soft services can provide resilience, and what is the actual cognitive process that is kind of the enemy for us that makes us kind of hesitate that should we prepare. Thanks.
Please.
My turn.
Yeah.
All right. Great. Thank you. There were a lot of things, of course, that were kind of raising thoughts during the speeches. I wrote down a lot of things. Regarding resilience and preparedness, I think the social media is full of stuff, videos and kind of reports of the most prepared country in the world, Finland. I guess you have seen all the YouTube videos and in TikTok and whatever, which is partially true, of course. But then I'm actually referring to what I guess Petra said, is that capabilities can become assumptions. So to some extent, I think that's something that we need to consider. And also referring to the question that Mika posed, are we training as we should fight? Are we really doing that? And do we have operational level concepts, staff and reserves for doing that? That's the question I think we should pose. And because
as we know, the warfare has changed a lot to hybrid operations, to information war, to cognitive war, so affecting opinions. So it's not only physical, it's very much about opinions and the cyberspace and cognition. So for example, I was just paying attention to the picture we had on the wall in the morning, stating the kind of position of USA versus China, how people think about their the values and their position. And China is becoming more respected than US, which is, you can ask a few questions why and what has actually caused that. Of course, they are themselves doing lots of stupid things, but there is also something else behind that, most probably. So the fight is not only physical or in physical domain in that sense, and this is very much kind of from a human's perspective. So it's not technological at all. And the second thing I would like to actually kind of coming out of this is the threat definition that we spoke about. It's very important to have a kind of a similar definition of the threat, what we're preparing for. Again, coming back to the physical versus cognitive threat and how to actually pose that or kind of what to do about that. And then we are coming to the preparedness of Finland, which as actually partially could be assumption. I'm pretty active reservist myself. We just had a chat with my friend who is also just yesterday. Okay, we have a big reserve. We have lots of trained reservists because of the conscription service, 1 million approximately, and a bit less than 300,000 are training actively. But that's not actually true, because not all of them are useful or capable of actually doing something in a war that we should be prepared for. So that's something that we should, I think, pay attention to a lot. So training, how do we train our troops? Because you said that military always comes and it's about somebody else. Like the first respond is about the civil society, but in Finland we are the military. You know, we are the military. There is nobody else coming. NATO maybe at some point, but it's up to us. So in that sense, it's a bit different here, and that's why it's very important to, I think, the individual kind of capabilities also. And then you wanted to speak about business, of making business in defense. So I think
let's not go that first.
So I'll come to that later.
Because I will ask you, next question is actually almost like a business, because we have now thought about, let's say that in Finland we have 5.5 million people, but many of those are actually officials. Because, for example, in the military, as you said, about 96% of the military is actually the normal citizens who are just drafted to the service. It's the same in the border guard. It starts to be also in the police. It starts to be that in the fire brigades. Red Cross is there, and as Paula said, the third sector is huge. So actually, we are arming the society in a way, but they are users. Those people are users. They are not customers. And I would first, what Daniel said, that we expect certain behavior from the people, but we don't give them tools. So who actually is your customer? Who is actually paying the bill? Who do you sell?
Yes, so it's a real privilege to be sat here, firstly, on this prestigious panel. So thank you so much for the kind invitation here, Vasa University. Yes, so to answer your question, really, it's the individual. It's the ordinary household. This is who I'm talking about. And I know I sit here in probably the most prepared society in the world at the moment. You know, the Finns really do get it right, and they're really a glowing standard that I think the rest of the world can adapt and follow. It's not going to be easy for them because they're so far behind. And Finland, it's within the culture. You know, that's the big thing here. I think to do with conscription, you know, you're already going through, you know, this idea of being prepared. So, you know, I do believe Finland are leagues ahead of anyone else. Perhaps Sweden a close second. Also, if you look a long way away, Japan are also a society that are very used to being ready because of earthquakes and that type of event. Also, in fact, Singapore are pretty good at civil defence. So I think what we're trying to do at Vival, you know, we've got a big job ahead of us, haven't we? Because it's also a learning, a teaching job that we've got. You know, for these other European countries that are not so prepared. So we need to, it's my goal to give those people the tools that they need to ride out a serious event. You know, if we just look at the wildfires in Spain and France right now, if you had to just run and leave your home, as many did, I would think for most, that was a pretty chaotic experience. So what we're trying to do is give people the tools that pressure becomes much easier.
So I understand that you think that the people are actually the customer, the normal people, when they get the idea that they have to be prepared. But then, Minna, if I think about that, what you gave us, the assistant nurse who doesn't understand where to go, what is the next place to work with in the crisis, where the crisis is needing more and more of her services or his services. Who do you think that the customer is who is providing that information to her or him? What is actually, who is paying the bills in a way? Is it the employment authorities, or is it the market who solves the problem, or what do you think?
Well, first of all, I think it's I think that experience actually solves many problems, because it's at this moment when you experience a situation, you learn from it and you do things differently. So in this sense, this is how it will be solved. The experience is already there, but the incentive to solve it is not there yet, because the situation is not as serious as it could be already. So that's sort of part of my response to your question. But I think that in this sense, it's society is both like the customer and the provider, because this is like where we are at, where everybody needs to contribute to a situation that we're all sharing.
I also used the word renewal, so actually learning from crisis. And now I would like to ask our techies, can we actually do that? Are we always kind of imagining the crisis and then trying to solve that? Or can we actually kind of learn from the crisis and learn when the crisis is on? So can we actually renew? And I will start from you, because you have to have those innovations, how you capture them, because what I think, for example, as if we are talking about cooperation, the cooperation is only there in some instances in the exercises, and then when the crisis is on. When the crisis is off, the cooperation goes away, and everybody starts to do their own business again. So how you capture that moment and make that as a solution, something new?
That's a really good question, of course. I was actually coming to that before, or as a part of my first part. In kind of as an opposed to business in civilian world or for civil customers, you can push whatever to the market. You can really create the market. You can invent something, technological gimmicks that you can actually sell to the customers if you're marketing it well enough. You can create trends and stuff like that. But for military use and for defense, that's kind of impossible because there is a real need. And as we can see in Ukraine, the need is changing really fast because the enemy is learning and adapting all the time. So the change is really fast, and you have to be able to adapt to the change as quickly as possible. So you just need to be able to be there, to be really close to the fighting troops, to the different stakeholder groups, and understand their needs and understand the change of the battlefield in real time. That's the only way to actually grab the moment. As we can see, Ukraine is capable of defending their self to the much higher volumes of Russia, just because they're adapting to the change fast. And that's the only way to actually create business, especially at the moment on the defense business, because nobody's taking crap anymore. Everybody understands that, hey, this is the game now. And of course, the big question is that, as we heard in the morning, and as the senior military officials usually say, is that of course we are not preparing for the war how it's done at the moment in Ukraine. We are preparing to the war of the future. And as you said, you were able to predict quite well how it will go. But of course, the happenings, what's happening on the Ukraine now at the moment, how fast it's moving, it's kind of a time machine to us. So we need to be there. We cannot kind of overlook and underestimate what's happening there. So I think that's the way how to really grab that.
Yeah. I will put it in the other ways to Markus, because I would like to think that Minna's assistant nurse is actually the guy who needs the support, and you have to be flexible and invent something during the crisis. Then you can't expect the officials to give you a huge letter of all the demands. You have to go there to the field. Are you ready for that?
Of course, we are ready. But I think this is a little bit wider question that I think we are a little bit missing the narrative in Finland, at least. What is actually our kind of target state of preparedness in the big picture? I would a little bit argue with that. So when we are coming to digitalized world, what is the kind of level that we should achieve, for example, in the companies? And the problem is that at the moment, companies don't have money to prepare. And we are kind of shouting in Finland that companies should prepare, and this is, of course, this is good business. Then you kind of make decisions that are benefiting your kind of business continuity. But how about you don't have money? So this is a wider question that how do we get those resources? But to the solution, for example, we have in Finland lots of innovative companies that can create different kind of integrations on fly. So we need to kind of enlarge the thinking that what kind of solutions that we are using daily basis can be used in the time of crisis. So you don't have to teach new kind of tools for the people. They are used to kind of use those tools in a daily basis. That's how I see it.
I also share that the idea that the tools that you are used to use, they are the best used tools also in the crisis. But then I will highlight one thing that we are not so good in Finland, and that's the alarming the citizens system, which we have been kind of trying to do for years. And now something is already happening. But let's assume that problem will be solved. But how we can do that nothing like that ever happens again? So what do you think, Ilari? What should we learn about that that thing that we didn't be prepared when we needed that?
Yeah, I would put it that way, that we were prepared. Those crises and situations, what we assumed that we are facing in this decade. But in the last 2, 3, 4 years, the situation has extremely changed, and the politicians were not aware and awake to change probably the priorities of the money and priorities of the development. We were quite happy. We had sirens in the cities, and we have still, for example, the 112 application for the citizens, but then we faced the situation that everyone don't use it, or there is some other issues why it doesn't work. And then the politicians were ready to change prioritizing, and then we get money for the self-broadcast, as the same situation in Sweden also almost in the same moment faced that the self-broadcast is the only way to face and get contact to all and alarming all citizens.
I want to ask you about the trust, because I think that we are in the resilience seminar, but I think that the trust was the word that was mostly used by everybody. What should we do that the people trust that somebody knows what happens when the crisis comes? Somebody knows where to work, somebody knows how to alarm, somebody knows where the normal people should go if you have to leave your home, for example. Isn't that one big question also for the studies, for the research? How do you think about that as a research topic?
It's an important question, I think, particularly given the current information environment with lots of disinformation and fakes and everything circling around, and you actually don't know, is this the prime minister or isn't it? I think that trust is something that we don't build instantly. Trust is something that we build over time, long time. Trust is something that, that grows out of functioning a functioning society, when people see that the bus arrives in time, that schools are working, that services are delivered. That's how we learn to actually trust in society. We have a functioning society. Then it's about okay, how can we trust the warning systems? Yeah, it's about creating those really safe warning systems that cannot be hedged by someone else sending fake messages. But then it's also about, I think it's also about giving population building a welfare society sounds like very vague, but actually somehow encouraging a population that's allowed to be creative in situations when we don't know if we can trust or if we cannot. Because if we are creative, we can find solutions no matter what is going on. And that's something we can see, like in Ukraine, for example. That's a low trust society, but people are also very creative, and I think creativity is a very useful in a crisis situation. But in a sense, how to say, just to summarize, building trust is a long-term project. Building stable institutions is a long-term project. But we can also trust is not only from citizens towards politicians or officials or institutions. It's also the other way around. It's the trust that's coming from institutions, from politicians, from decision makers, that we actually have a capable population that can be creative and solve situations.
It was really good kind of end for this panel, because as what I understand about what you said is that the government should also trust the people, not to the other way around. So it's kind of committed. And I'm not letting you, Daniel, anymore, but I'll quote you to the last words that I will say. You said that when you take care of your own security, you are not selfish, but you are letting the authorities and the others to help those who couldn't do that. And I think that's a very good idea also, so that we could rely on those things that we know and which are functioning, so we can concentrate on those which are our problems. And I would say that was one of the biggest things that I learned today about that kind of how to send the message for that. And now the panel is ended, and Malla will say the last words.
Malla says thank you for the panelists, and thank you for coming. And this is not the last time you are here. You are going to be in contact with us and Vaasa region's Nordic biggest energy cluster a lot. I hope so in the future, also in these cases and this team, but also otherwise. And you are very welcomed here. And now I know some of you have to rush to the train. So Markus is coming to give the rest of you some memories from here. And thank you very much, and big applause to all the panelists and keynotes. And thank you once again that you were here from our side and from Vaasa University of Applied Sciences and Vaasa Future Festival.